शुभ नाम तब शुभ आशीष मांगे
थोड़ा लेफ्ट लो आगे
गाहे तब जय गाथा भारत भाग्य विधाता जय
Thank you. Foresight and business ethics. Good morning, ladies and gentlemen. A very warm welcome to the Golden Aims Conference and Award for Excellency and Leadership. It is indeed my pleasure and my privilege to be a part of this December gathering of top professionals and industrial captains. May I have your hands, please? You're shaping the Indian globe story with your inspirational leadership and entrepreneurial success. We are honored to have you all with us this morning. This has indeed been a remarkable journey, and to set the tone for this day, let me invite Dr. Farheen Khan, co-founder of CFO Golden Aims Brand Ambassador, Asia GCC. Also, may I have Azhar Farooqi, CEO and co-founder, Dynajik Business Solution. Thank you. Also, may I have on stage Dr. Manoj Gandhi, Director of Dr. Gandhi Nursing Home Private Limited, Secretary Bombay Nursing Home Association. Also have Dr. Sharma on stage, please. Sanjay Sharma. And Dr. Tanveer Abdul Majid, please. Thank you. Thank you. In the midst of so much destruction around us, of the market of science professional industries, how about a destructive side of leadership, one that shakes things up, get the best out of the team, and yes, gets the work done? Perhaps that's the call of the day in an environment of rapid change. The leaders of Golden Aims Conference and Award for Excellence and Leadership command authority as well as respect, and yet we flatter organization structures and decentralization of decision making and empowering their team. May I now invite Dr. Farheen to say a few words. Thank you.
Good morning, everyone. I'm excited to share this morning with these dignitaries present here today. I, Dr. Farheen Khan, co-founder and CFO, Golden Aim, and Chairperson Asia GCC. Welcome you all to the 10th edition of Golden Aim Conference and Award. I would like to take this opportunity to extend the warm welcome to all the participants, the speakers, and other guests for gracing this occasion. Depending on the theme today, innovations, and digital era. Life would be so different if all our different dream comes true. Life would be so different if everything we did with the spirit, hope, passion, and achievement, and with the selfless determination to make things happen today. The digitalization is considered the third industrial revolution or the digital renovation, which began in the 20th century. Now we are shifting towards the digital era where everything is turned digitalized. The applications of digital technologies which are being forwarded to each and every industry. In every aspect of human life, moreover, today a very rare point out any sectors which are outreach of any kind of digital technologies. After noticing the importance of digital technologies in our daily life, we can say that digitalization has come to the hour. The live example is the corona pandemic. The battle with the various virus has been possible only because of digitalization. However, the era of digitalization is bringing a promising future to our world. I would not take much of your time and end this beautiful quote. Transferring is not the technology, it's the technology that is transforming you. Thank you everyone and welcome you all once again.
A very pleasant morning to all of you, and a very warm welcome to this 10th edition of Golden Aim Conference and Award. Firstly, I would like to extend my note of thank you to everyone for becoming a part of this event and gracing it. I, Mohammad Azharuddin Farooqi, the CEO and co-founder of Dynamic Business Solutions and the Managing Director of the Pharma Global Management Services. My company, Dynamic Business Solutions, we provide solutions in various segments and sectors, such as we are in the manufacturing industries, we are in the healthcare manufacturing industries, and we have the fitness academies, and we started the electronic business also. We provided end-to-end management solutions. We started our business in 2004 with a small warehouse in Mumbai, and with the team support, we built our business to national to international level. We have nationally, we have the chain in the Mumbai, Pune, Delhi, Bengaluru, and West Bengal. And internationally, we are in Dubai, Oman, and Indonesia. And I hope to build more chain in future. And very thank you to the Golden Aim team to give us a chance to be a partner of this the event. And the platform where the professionals and the thought leaders share their views and the knowledge. Thank you so much and congratulations to all of them. Thank you.
So actually I'm from Pune and presently I'm president of Indian Medical Association Pune branch. And this topic is a favorite topic of mine. And I was very glad when I got this invitation of speaking for digital health promotion. And this will go a lot for increasing the availability of our consultants. It will be increasing the consulting of practice of many people for the benefit of the patients. And it will be useful for all those people who are not able to reach and clinic. Hello, can you hear?
Yes, ma'am. Yes, ma'am.
Okay. Can you see my screen because I cannot see? Yes, okay. Okay. So, as per the head of Maryland Clinic, USA, Dr. Farhim Yunus had told us to live with COVID-19 for months or years. And let us not deny it, let us not be panicky, and let us learn to live with the situations. So now, with this practice, which was already like a daily work, if you can see on this Happy Doctors Day, this cartoon was going around so many times that now the doctors are facing attacks they are facing the inflation, they are facing illogical medico-legal cases. So along with this, now we have to face corona pandemic, HIV pandemics also had just gone, and TB pandemic is again coming up. And along with this, what we feel is that inability of a person to travel long distances or inability of a person to attend to somebody, to take him to a doctor, is becoming more and more rare and difficult nowadays. So telemedicine was started from about February 2020, when our seniors recognized the need of telemedicine. And it has been permitted by Medical Council of India from February 2020 or March 2020. So remember, when we say hello and we pick up the phone, it is starting with a girl's name. So it was a initial beginning of Margaret Hello, who was a girlfriend of Graham Bell, who invented telephone. And the first word on his phone after his invention was hello. And that is how we started talking with hello. And that is how we got now into a telemedicine, which is medicine from a distance, a remote medicine. What are the advantages of telemedicine? If you can see from this slide, you can understand that how the patient is having a changing lifestyle. Patient has accepted the disease, but there is a problems in management. So we have a telemedicine which gives you a higher quality of life because it gives you a disease management remotely, reduced periods of hospitalization, transparency of costs and services. There will be lower, not medication cost, but a supervision cost. And this will give rise to a higher efficient management of a disease of a patient, especially by a physician, and to the benefit of the patient, to the benefit of the caregivers, to the benefit of the caregivers who are there with the patient, staying with the patient. So doctors need a clear set of do's and don'ts, as they are accountable to provide teleconsultation as per the telemedicine practice guidelines. This constitutes the Appendix 5 of the Indian Medical Council Professional Conduct, Etiquette and Ethics Regulation Act 2002. A violation of the telemedicine guidelines will give the patient's avenue to complaint against the doctor before the appropriate state medical council for misconduct. So doctors have to have a knowledge of do's and don'ts. These guidelines were prepared in partnership with Niti Aayog, and they were introduced as amendment to the Indian Medical Council Act that gave a statutory support and basis for the practice of telemedical medicine in India. That means these guidelines are the correct guidelines and you need to follow them word by word. So what is the proper definition of telemedicine? Telemedicine is defined as a delivery of healthcare services where distance is a critical factor, whereby all healthcare professionals, they can use the technology, the information for the exchange of valid information for diagnosis, treatment and prevention of disease and injuries, plus research and education, and also for the continuing education of healthcare providers, all in the interest of the advancing the health of individuals and their communities. So who can do a telemedicine consultation? A RMP, that is a registered medical practitioner, MBBS and above, under the Indian Medical Council Act 1956, is a person who is enrolled in the State Medical Register or the Indian Medical Register under the IMC Act 1956. So whoever is enrolled in the State Medical Register as an RMP can do a telemedical consultation, or a National Medical Commission Act 2019, when it comes into full force and replaces it. So guidelines given according to that guideline, if they come, then those can be authorized persons for giving telemedical consultation. What are the authorized methods? Authorized methods is via any medium such as video, audio, text, WhatsApp, mobile, computer applications like Skype, Google Hangouts, etc. And modalities. Who can give to whom? That is, a patient can, you can give, RMP can give to a patient, RMP can give to a caregiver, or RMP can give to a healthcare provider, or RMP can give a telemedicine consultation to a different RMP on the other side of the other side of the area. So what should be the guiding principle for all telemedical consultation? Is a registered medical practitioner is well positioned to decide where a technology-based consultation is sufficient or in-person review is needed. And this is most important, that the registered medical practitioner himself or herself can decide whether the complaints of the patient can be connected or can be properly counseled, communicated by a online consultation or by an in-person review. So the decision should be of the doctor. The practitioner shall exercise proper discretion and not compromise on the quality of care. And 7 elements need to be considered before beginning any telemedical consultation. First is the context, that is the context of the complaints. Secondly is the identification. So the doctor and the patient should identify themselves online in the recording. Then the mode of communication should be identified. Consent should be properly documented. Type of consultation should be decided upon. Then the patient evaluation, and then the patient management. So the context, the first thing is the context. So how the context should be there, it should be appropriate and sufficient. The doctor should be able to provide telemedicine consultation by adequately prescribing medicines, by providing counseling like food restrictions, do's and don'ts for anti-cancer drugs, proper use of a hearing aid, etc. And doctor should be able to impart health education, that is the counseling regarding advice on contagious infections, immunizations, exercises, hygiene practices, mosquito control, etc. The second is that the identification factor should be clearly defined. Especially for the first consultation, patient identification is mandatory. So patient himself or herself should say out that I am so and so, my age is so and so, I am living in this area, and the disease of that person should be called on. If a caregiver is speaking on behalf of a patient, then caregiver identity and authorization should also be checked. Doctor himself or herself should identify to the patient before the start of each consultation, and the registration number at every touch point with the patient should be emphasized. Mode of communications is via any medium. The doctor can choose a suitable medium of teleconsultation. Like I told you before, it can be an internet, it can be a mobile app, it can be chat platform, or it can be a Skype, email. So decision should be taken by doctor as per case-to-case basis. Patient is responsible for the accuracy of the information which the patient is giving. That is what I told you in the previous slide, that whatever the patient is giving you information, you are going to act on that. You are going to counsel on that. And that responsibility of that information is the responsibility of the patient. So know the limitations of the various modes of consultation. In the video consultation, it can come closest to an in-person consult with an inspection, which depends upon the high quality internet connection at both the ends. And it also should ensure privacy of the patients in the video consultation, which is very important. Then in only audio consultation, it is convenient, fast, it has got an easy reach, but non-verbal cues may be missed, and it may not be suitable for conditions that require a visual inspection. And sometimes there is a text-based consultation in which questions are asked and answers are given. So in these, the visual and the verbal cues most may be missed, and it may be difficult to establish rapport and a proper communication with the patient. The fourth aspect is the consent of the patient. Consent of the patient is implied when the patient initiates consultation, but it should be explicit when a doctor starts a consultation. So when a doctor starts with a consultation first, the consent of the patient should be taken in an explicit manner. A healthcare worker, RMP, or a caregiver when he or she initiates a telemedical consultation, it should be recorded in any form, either in a chat box or in a paper, and then the paper should be shown, or otherwise it can be explicitly told or expressed out while consultation. First consult means the patient is consulting with the RMP for the first time. The second consultation means if the patient is consulting after 6 months of the first consultation, will count as second consultation. Or if the patient consults within 6 months of the first consultation, it will be called as a follow-up consultation. So a patient consulting with the same RMP within 6 months of a previous in-person consultation will be a follow-up consultation. Remember, it will not be considered as a follow-up if there are new symptoms that are not in the spectrum of the previous treatment. Not only the RMP, even if the patient doesn't recall the context of the previous treatment and advice, then also it will be taken as a new consultation. So any new symptoms, new areas of coverage, and new complaints of the patient will be taken as a second new consultation. How about patient evaluation? Exchange of information for patient evaluation should be adequate. If the doctor is not convinced with the information at hand to make a professional decision, he may ask the patient to change the mode of consultation and provide such documents or undertake such tests as required. RMP shall maintain all the patient records, including case history, inverse images, etc., as appropriate. Caregiver is deemed to be authorized on behalf of minor or incapacitated patients. In such cases, the teleconsultation can take place with the caregiver without the presence of the patient. Doctor is not to continue with teleconsultation if it is not appropriate or not satisfied. Patient's personal data should not be disclosed or transferred without the legal and written consent of the patient. Doctor should not deny in emergency teleconsultation, but it should be limited to immediate assistance or first aid only. And the doctor should know the limitations of prescriptions of medicines. How can the emergency consultation be given? The telemedicine services should be avoided for emergency care whenever alternative in-person or actual personal care is available. Telemedicine consultation should be limited to first aid, life-saving measures, counseling, and an advice for proper referral. In all cases of emergency, the patient must be advised for an in-person interaction with an registered medical practitioner at the earliest. So it will be only emergency management guidelines and a counseling as to how the patient should go forwards or to go to which area, which hospital, which doctor for the next immediate treatment. In order to prevent abuse, remember that the telemedicine guidelines require every doctor to prescribe medicines via telemedicine only when the doctor is satisfied that she has gathered adequate information and relevant information about the patient's medical condition and the prescribed interests are in the best interest of the patient. Prescribing medicines without an appropriate diagnosis can amount to professional misconduct. So unless you can gather a full idea of the patient from the relevant data which he has provided and from your online checkup, then only you can prescribe a proper medicine. How can you prescribe a medical or give a prescription? Online. So online, on the letterhead with an MMC registration number, first of all, the provisional diagnosis should be mentioned. After that, the RMP shall photo scan digital copy of the signed prescription to the patient via email after writing the prescription, of course. So first is you should write your MMC number, your name, your MMC number, your telephone numbers. Then the diagnosis should be mentioned. And then the prescription, after writing it in proper handwriting, it should be scanned. And the digital copy should be sent via email or messaging platform to the patient. If the transmitting the prescription directly to a pharmacy, the person should ensure explicit consent of the patient that entitles him to get the medicines dispensed from any pharmacy of her choice. Also should give a receipt or an invoice for the fee which is charged. to the patient so that the patient keeps the bill of it. As a thumb rule, as an important thing is you should remember as a thumb rule, prescribing medicines for chronic diseases should be avoided for long term during teleconsultations unless it is an add-on or refill of the earlier prescription obtained during an in-person consultation less than 6 months back. If a prescription for chronic diseases is to be ensured, then the video consultation should be done strictly via video because chronic diseases require a video consultation to assess the improvement or the deterioration. If the teleconsultation with the patient does not take place over a video, doctor can only prescribe over-the-counter medicines like paracetamol, ORS or cough lozenges or cough medicines also you can prescribe. Add-on medication where the in-person consultation was less than 6 months ago, and a few emergency medications, even if they are not OTC medications, as and when notified by the government. So few medicines can be prescribed even if an online video consultation does not occur or cannot take place. Only remember few things that emergency contraceptives can be prescribed on phone or by telemedicine, but medical termination of pregnancy pills can never be prescribed by online method. Patient has to go physically to the nearest center because it is not an emergency. You can go within the requisite amount, that is amount of days, that is first trimester can be done within 9 weeks or 12 weeks of pregnancy, second trimester between 12 to 16 or 20 weeks of pregnancy. So this is the table which shows a scope or the limitation of the prescription. If a prior in-person consultation is not done, then a RMP can prescribe only OTC medication like paracetamol, ORS, antacids, cannot prescribe medication for which diagnosis is possible only by video consultation like antifungal medicines like eye medicines, cannot prescribe add-on medication, cannot prescribe refill medication, and cannot prescribe habit-forming or narcotic or psychotropic drugs. If a prior consultation in person, it is physical consultation for the same health condition has been done in the prior 6 months, then a follow-up consultation which is done in the within 6 months, then you can prescribe an OTC medication. One can prescribe an add-on medication which are used to optimize an already existing and stabilized disease. Like you can add one more antihypertensive, or you can add one more anti-diabetic medicine. Then one cannot prescribe medication for which diagnosis by video consultation is done. That is there. Cannot prescribe refill medications and cannot prescribe habit-forming medications for video consultation is not done. So what are the exclusions in guidelines? Is there specification for hardware, software, infrastructure, building and maintenance? Data management systems are to be involved and standards and interoperability measures to be taken. Use of digital technology to conduct surgical or invasive procedures remotely. Other aspects of telehealth such as research and evaluation and continuing education of healthcare workers does not provide for consultations outside the jurisdiction of India. So these are the exclusions in the guidelines. This is the medico-legal advisory, which is now shows that telemedical consultations are now covered under the health insurance. And there are guidelines from IRDIA saying that telemedical consultations with a medical practitioner allowed done in proper guidelines and in terms and conditions of a policy contract can be a part of claim settlement of policy of insurers. So patients will now be able to get health insurance benefits even if they consult doctors or hospitals using telemedicine. So thank you all for patient hearing and all the best for litigation-free practice and a healthy yourself for you. So thank you.
I apologize for the video. I know it was small, but I'm glad that the message was conveyed beautifully. Thank you for your patience. And now we can quickly start the awards. May I have on stage Dr. Farheen Khan and Azhar Faruqi to present the awards, please. May we first have Dr. Sanjay Sharma, Director, Professor Oncosurgery, Asian Cancer Institute. May we hear for him, please. Come on, people, we have your turns as well. Thank you, Dr. Sharma.
Good to see you.
Now may we have Dr. Ramakant Deshpande, Chairman, Asian Cancer Institute, ACI Kumbala Health Hospital, Thames Corner, Mumbai.
I'll take the one. He's not there.
Okay.
He's in the flight. He couldn't go on the line.
Alright, he's still traveling. Thank you.
We'll thank the Digital Solutions, the Golden Award group, Dr. Fardeen and Dr. Faruqi, to have given this honor to us. In fact, I remember that this is the third time that we have got it. And this award for me and Dr. Deshpande is an award for the Asian Cancer Institute group. We are all ex-Tata group. My colleague, Dr. Tanveer, is also around. Dr. Gandhi is a colleague. He's been worked with us in Tata Memorial. So all of us are now outside Tata Hospital after we have completed our 10 years at Tata. And now we're trying to give the same facilities that were probably too much of rush in Tata Hospital at different places in all. And we have now 4 centers, 2 in Mumbai, 1 in Indore and 1 in Bhubaneswar. And hopefully we have more institutions. And you'll be happy to know that Asian Cancer Institute is totally digital. Everything is digital, including the consultation if required is digital. And all the things are recorded. Nothing is written, handwritten, but everything is digital. So I must thank the organization to have this award to me and Dr. Deshpande, my colleague. And I thank you all and have a good journey in future for growth of Golden Group in different spheres. Thank you very much.
May we have Dr. Tanveer Abdul Majid, Cancer Surgeon, Kokila Pain Dhirubhai Ambani Hospital, Navi Mumbai, Zen Multi-Speciality Hospital, Mumbai, and Asian Cancer Institute, Mumbai.
This award is dedicated to my teacher Sanjay Sharma sir and Dr. Deshpande. Without them, I was nothing. They taught me everything of oncology, and this is what I am here today because of them. Thank you, sir, so much.
Thank you. And now we have the Dilka Doctor, Dr. G.P. Ratna Parkhi, Consultant Interventional Cardiologist, Guru Kripa Healthcare Center. This is an outstanding contribution in field of healthcare cardiologist.
Sir.
All right, and now the iconic Healthcare Leadership Award neurosurgeon, Dr. Mohnish Bhattiwale, neurological surgeon and managing trustee of Neuro Health Foundation Clinic. May we have you on stage, sir.
बहुत शुक्रिया. I really want to thank the organization, Golden Aim Award organization, for giving me this award, mainly because the Neuro Health Foundation actually stands for the importance of the brain today. So many decades have gone concentrating on other organs of the body, but today we see that diseases of the brain are really increasing in tens of thousands. COVID actually brought about an acceleration now. Many may not be knowing, but the fatigue which COVID has caused, the fatigue actually is resulting in a lot of migraine headaches and as a consequence, even strokes. Another factor which I'd just like to quickly highlight is the impact of global climate change on the diseases of the brain. And today, as you can see, what the newspaper today is saying, this is winter going on or summer is a question to everybody. So such climatic changes have a direct impact on the brain circulation. And Neuro Health Foundation, our organization which is working since 2009 and has treated more than 1 lakh patients here in Mumbai itself, concentrates on these two very important aspects. Another aspect we look at is a neglected aspect, public hospitals and medical teaching. And we feel that all as we move and become greater doctors and big names, I feel that we all have a responsibility to look back and see what difficulties we faced as young doctors. One, mainly because public hospitals still are quite a mainstay of healthcare for poor people. So on that note, I'd like to again thank the organizers and thank you again for highlighting the importance of brain in the coming times. Thank you very much.
Thank you very much, Doctor. May we have our next speaker, Dr. Manoj Gandhi, Director, Dr. Gandhi Nursing Home Private Limited, Secretary, Bombay Nursing Home Associations. And the topic for him today is health insurance, very important for us.
Good morning, everybody. I would like to first thank the organizers to invite me for this very important topic of health insurance. I would first like to know as to how many people are there from the insurance sector in the audience today. From the health, is there anybody from the insurance company side today? No. And how many people are there from the healthcare provider side, like from the hospital side, who are dealing day in and day out with the cashless? Can I have the raise of hands? So now I have been there working in smaller hospital. I've got my own hospital. I've been working in corporate hospitals. I've been working in cooperative hospitals, and I've seen work patterns in government hospitals also. Health insurance is a type of insurance offered by the government or private insurance companies that covers healthcare expenses incurred by policyholders for necessary. This is a basic, outline of what healthcare insurance is. And it is obviously the most important and critical planning for the individual. It is a contract between the insurer and insured, wherein the former agrees to pay to the latter hospitalization expenses to the extent of the agreed sum assured in the event of any medical treatment out of an illness or it. Where does the role of the hospital comes over here? This is just a contract between the insurer and the insured, insurance company and the insured. Actually, the hospital is the main player over here, but 99% of the times, the hospital who gives the credit to the insurance company for serving their customers as patients are bulldozed by these insurance companies, especially the small healthcare providers. I am the secretary of around 700 nursing homes across here in association having called as Bombay Nursing Home Association, which has seen all the patterns of changes of the working patterns of most of the insurance companies and TPAs. So, in a layman language, the health insurance is a policy which covers you and your family against medical expenses due to sickness, accident. The insured in return has to pay. So, for the doctor or the hospital, the payment, whether it comes from the patient, if he goes for his reimbursement or direct payment or a cash payment, or whether it comes from the insured, it doesn't make a difference. The hospital has to sustain. If it has to give quality service with infrastructure upgradation, there has been a huge change post-COVID in the infrastructure requirement of the majority of the hospitals, whether it is a small hospital or a larger hospital. Obviously, even if the hospital doesn't do profit, to provide quality health care, to provide sustainable health care, to provide sustainable infrastructure, there has to be some remuneration flowing to the hospital. It's not a question of only growth of the hospital. Obviously, with growth, the infrastructure requirement, technological requirement, upgradation of the medical equipment, but there's a definitely continuous running cost going on for the hospitals, which needs to be maintained. So, definitely everybody knows that the cost of healthcare is rising. The government is behind us to reduce the healthcare, but with technological upgradation, it is very, very difficult to reduce the healthcare. It can be reduced and made sustainable if we all work in a synergistic manner. The health insurance decision is not whether to obtain it, but which health plan to purchase and how much coverage to purchase. Now, many of the times, we always have that trademark statement on all the advertisements, read the minor document, minor lines and but many a times, who has the time? You tell me which of you all in the audience have actually read the first page to the last page of the insurance policy. I'm sure none of us. I have not read. So there are many things written in those documents where the education has to be passed on by the insurance agent or the insurance company to the customer or the corporate who are insuring their employees. So options for purchasing health insurance. There are two types basically, a corporate insurance and individual insurance policy. And then there are government sponsored schemes like the Ayushman Bharat and other states having their individual insurance policies for their population. The self-employed individuals must obviously pay the entire cost of the health insurance. In case of the corporate or the government-sponsored insurance company, it is either the government who's paying it or it is the corporate company that pays it for the employee. It may be deducted in some form or the other from the employee's salary, but ultimately it is the corporate who initiates the payment. Health insurance again is offered by insurance that covers healthcare incurred by policyholders for the necessary medical care. And it's a critical component. Group health insurance. As I told you, many employers offer health insurance as part of benefit package to the corporate and the group employees. Here the major problem that occurs is that the employees are only told that they have got a Medicare policy as a part of benefit of their employment contract. But there are a lot of restrictions depending on the grade of the employee, class of the employee, whether he's an A grade, B grade, C grade or D grade employee, depending on whatever level his employment contract is there. So some of them will have, restrictions in the charges, some of them will have restriction in bed charges. Ultimately, those are not disclosed or majority of the times not disclosed till the patient comes for admission. Or he is not even aware of it, these are the restrictions. That creates a lot of hassle for the providers, because when the employee comes, his understanding is that everything is covered. by my corporate company. But when he actually comes at the hospital and when the initial approval comes, that is the time when we come to know that these are the restrictions. And then a lot of play around happens by some of the patients that we want to adjust here and there. This doesn't cause a smooth flow of events right from initial admission to the final discharge. So if we have to have a smooth journey of a patient for cashless work or cashless medical treatment, then I think all corporates should disclose these individual small restrictions that are there to the employees in some form or the other when they come for admission. So the journey becomes easy, and the hospitals also know that what is to be collected as extra if required, not required, depending on the final approvals. I advise all the corporates to actually, or the employees of any corporate company where insurance is provided, to have a parallel individual policy. Because most of the individual policies of good companies do not have majority of the restrictions. So then they can get the proper benefit of the treatment wherever they go in whichever hospitals. And again, healthcare providers, it is called as managed healthcare plan, under which individual receives services from the specific doctors or hospitals that are part of the plan, or health maintenance organizations. This is a term coined by the government insurance companies like New India, Oriental, United and National. I don't know how many of you all are aware. It was initiated as a GIPSA group of companies. Here, the problem is that even if we want to work for them, they create a lot of problems for smaller hospitals. And there is a huge difference in how these people, do the tie-ups and process the claims. So if we do not bend down to their rules and regulations and restrictions, then they might not take the hospital on panel. Although this may be covering, I'm sure the government insurance companies are covering around 20 to 30% of the total insurance market in India. So, which if we have to cater to this group of people, there are many hospitals who are not catering to the GIPSA group of companies, which is a collection of the main 4 companies of government, that is the New India, Oriental, United and National. Plus, if we don't come to their terms to be on panel of those companies, then they try to tell us that we will not take you on panel to provide the cashless process, or we will want you to have a very reduced tariff for doing this. Now the hospital which is absolutely new or is not having footfalls, for them this may be important, but a hospital or a doctor who's having his own reputation, this may not be a criteria. All these patients are actually then reimbursed at their standard rates of the hospital. So I'm not saying that nobody should remove the government insurance companies, but then these are the problems that they may not get access for cashless treatment at all the hospitals wherever they want to go. So I put it as like this, that health insurance should be responsive, responsible and profitable. And who are the people who are responsible for it? So this is the entire chain. The who's are insurance companies and TPAs, individual patient and corporates, and doctor and the hospital. Without this, the entire game plan goes for a toss. Now, responsible means readily reacting or replying to a people or events or stimuli showing emotion. Now, in health insurance, emotions do not play a role. Because ultimately when it comes to an insurance policy, it is a financial transaction. So where does emotion plays a role when a doctor is treating the patient. But if you take the two aspects, whether it is the medical treatment and whether it is the financial commitment, both cannot be associated with the emotional component. Responsive, submission of correct documents to the hospital, how early and whose responsibility. 90% of the time the patients will come to the hospital without their document. They will go to any other place, stand in a queue, submit the proper document. If a person goes to the bank, he will obviously take his bank, passbook, checkbook. If he goes for property registration, he will take all the required documents that are required for it pretty much in advance. But when he comes to the hospital, definitely half of the documents will not be there, his medical records will not be there. This is going on. We are trying to improve this. We are trying to educate the patients. At least at my hospital, we ask for all the documents in advance. So, digitally. In fact, COVID has taught us the digital revolution in everything. So, I just now heard Dr. Meenakshi from Pune saying that since March 2020, we have started teleconsultation and all. I've been doing teleconsultation since 7 years. So, it's nothing new that teleconsultation is actually there. It was always there. It's that COVID has given us a big boost, and everybody has taken advantage out of it. Even the health insurance companies have gone digital, have launched their portals, So, but these things do not change. Every time a person gives a call, whether to the hospital or to the insurance company, 90% of the answer is under process. Now, this under process in any call center doesn't have any meaning, because till the under process team gets their answers, it's a day elapsed in the treatment of the patient. Initial approvals, delays. There are some good companies who send, who are very prompt in their replies to the hospitals. So it makes the hospital work also easy. They can concentrate on their medical treatment rather than doing, all this jugglery around getting the initial approvals, final approvals. So there are some insurance companies and TPAs who will give you initial approvals in 15 minutes, 20 minutes. Nowadays they have tag times for that also, and final approvals also. So the process has to be smooth. Nothing has to be delayed for the patient's admission, as well as for, if there is a rule where government is wanting that every emergency should be treated immediately at the hospital, we also as hospital providers would want all the processes to be smooth. Now, I want to lay something on this hidden facts by the patient, doctor and hospital. This is going to be always a grey zone where, certain ailments, certain pre-existing disease, which are hidden by a lot of people. It is hidden by patients also, it is hidden by doctors also. It is sometimes overruled by the insurance company agents also. So, this is such a grey zone that it is very difficult to deal with it, but slow and steadily, I think all insurance companies as well as hospitals are coming around it, and obviously it should be mandatory that all pre-existing disease should be disclosed in all the medical records submitted by the hospital, which is obviously the most important document, but primarily it should be a protocol of the insurance agent who removes the policy. At that time all those things have to be disclosed, but 90% of the time today, or earlier also, everything happens on telephone, digital, and policies are automatically renewed or removed. So majority of the time at the inception only there is a problem. So if the policy initiation is going to be a problem, then eventual utilization is going to be even more problem. Obviously, in case of an individual patient, it is the responsibility of the patient to submit everything to the hospital. But most of the times, as I told you, they come with incomplete documents and agents. 90% of the time, they will not come with their papers properly. 90% of the times. And in case of corporate patients, I told you, they will just come and flash their card. This is my card, I want cashless. Which is not the correct. There's nothing mentioned on it. What is the copay? What is the restriction? Nothing mentioned on it. I've had a tough fight with most of the insurance companies. We at least want to know, just adding a small line of copay below the card is not going to take a lot of space in the corporate policy holders. So the hospital and the patient also knows at the time of admission only that this is the amount that whatever, suppose the bill is 50,000 and the copay is 10%, then hospital is supposed to collect that 5,000 rupees. Most of the time, this is wonderful thing, if it's a high profile top end client from a top HR company, then their cashless and insurance and everything is pretty smooth. I have had one very beautiful incident where a top executive from a top corporate company, his wife was just admitted in a top corporate hospital for a maternity delivery. And there were 30 employees from the insurance company sitting in the lobby of the corporate hospital just to see that everything goes on. Tell me whether they will do the same thing for a person from Jhopalpatti who will have a 5 lakh policy. They will not do that. Is his policy different from the policy of that high-end customer? No. HNI customer? No, it's the same. He should get the same benefit what others are getting. So my point is that if you have an insurance policy, everybody should get the same benefit. Again, these initial approvals, final approval, medical knowledge, this is the responsibility of not only the doctor but also the insurance company and the TPH. I recently had two very good incidences where from one insurance company I had an enteric fever with colitis patient admitted at my hospital, and they troubled me throughout the day with 7-8 queries. There was a non-medical team, medical team from the insurance company raising queries. Ultimately they did not give me the approval. I gave all the explanation why the approval should be there, what is enteric colitis, medical knowledge given to them by me. In spite of that, they did not approve. Ultimately, due to peer pressure from the insurance agent, due to peer pressure from whoever higher up authorities were there, they passed the claim in the reimbursement. I came to know about this and I told the insurance company, whoever I know in that insurance company, that this is not justifiable, because if it was passed in reimbursement, it should have been passed in cashless. It would have avoided the hassle for the patient and the hospital. Just a week ago also I had a similar one condition called as leptospira fever with acute radiculitis of the spine. Same thing, and I get a reply from the grievance officer, we will reply after 5 days, by the time the patient goes home. On the third day, an investigating officer comes. Obviously by third day the patient who is not able to walk or weak will be little better. So a non-medical person comes from this insurance company and tells me that he is better. Why have you admitted him? You could have treated him on OPD basis. So my point over here is we are not against as hospitals. We want to cooperate with you all, to work with you all, because we are the focal point around which everything rotates. Today if doctors or hospitals are not there, where will the insurance companies go? Everybody is trying to make a pie out of it. But then consider that hospitals and patients, we are the focal points. It's not the insurance company which is the focal point. Scrutiny by non-medical patients, majority of the time, they appoint 12th pass. They're just still continuing, BCom pass. Most of the insurance companies will have, I'm not against any pathy, but they will have homeopathic doctors or Ayurvedic doctors who will want to come and justify that this is not an admission which is required, which is not the case. They can't come and challenge a super specialist that this is not justifiable. I can tell you a story about 17 years ago when I had a patient of diabetes with hydrocele, and we had a particular package tied up with insurance company, which was just for 1 day's admission, and he had come with a sugar of 500. So I sent a request to the insurance company, okay, we will control the sugar, do the surgery. Controlling the sugar might take 2 days, do the surgery 1 day, and send him with controlled sugar back home. So it will be 4 days. So they did not agree to that. Your package is just for 1 day, why are you admitting for 4 days? I said, fine. We will send the patient to your office, you will control the diabetes, we will operate, we will send back to the same day evening, I will send back to your office, and we will discharge the patient. You give us 1 day's package charges, we will have no problem with that. Ultimately they agreed for 4 days stay. So these small things now causes a lot of irritation to the healthcare providers who want to work with all the insurance companies. Now the same thing I was telling about the GIPSA group of companies. I don't want to say it openly, but the truth is that if we don't agree to their rates, or we don't agree to give them a pie out of something or an extra discount, they don't want to take the hospitals on panel. How do we treat those 30 to 40% of the patients who are insured with the government insurance companies? And then government wants us to work for them. How do we do that? We also, as doctors who are running the private health, I'm doing charity now. I'm doing 100 laparoscopic surgeries a year in my own village, totally free for patients. So we can't do charity at every level. When a patient is insured, the hospital or the doctor has to be assured charges which are justified as per the market scenario. Again, the same thing, standard billing patterns. We've been after a lot of insurance companies to, have everything standardized. But till date, you'll have, portals who are having various forms. We give them suggestions also, but their suggestions are always to be accepted and granted are always under process. I like this word, under process. In any corporate, if nothing is being done, the emails rotate around within the employees and the answer that the opposite party gets is under process. Now discounts also obviously at the total discretion of the hospital. The insurance companies cannot demand the discounts. If the hospital wants to give, but unless we tell them that we are giving this much amount of discount, they don't take the hospitals on panel. So there are a lot of small hospitals who are not doing these government insurance companies and GIPSA because of the same reason. Even major corporate hospitals who are facing troubles with them are not doing GIPSA work. Even private insurance companies where few are creating problems are not being processed, and treated. So you can't have that all insurance companies will be on panel of all the hospitals. That will be the ideal scenario, so the patient can have the right to go anywhere where he wants to, his desired doctor, to his desired hospital. But that is not the ideal scenario. Obviously, health is important for everybody, and for the corporate, having a good healthy employee is benefit in terms of his medical health. Now, is it a profitable venture for insurance companies? Everybody assumes that it is not. But if it was not, then why would we have so many privatization of insurance companies? Even government is contemplating privatization of everything in insurance. There's going to be mergers of the PSUs. It is going to be merged with LIC also. So we don't know what is going to happen. But maybe budget 2023 and things may change again. So definitely there is a market for profitability. How they balance it is a different thing. There are different roles of play. They can balance it with their life insurance policies, or they can balance it with their premiums collected for medical policies, car insurance policies. So it's not that it's not profitable. They have to manage their claim ratio, which they can manage. It's not. And obviously their own infrastructure cost is high. You'll have 12 pass or the pass guy coming with a tie, sitting in an AC comfort, trying to process our claims. There will be 50 employees sitting in a call center of an insurance company in a comfortable environment, which is not the case of the nursing staff in the hospitals. They will not get that same benefit. But it is they who are, in fact, who has treated the patients during COVID? Can you all answer anybody? Who are the prime people responsible for treating the COVID patients? Is it the doctors? Is it the nursing staff? Is it the administrative staff? It is the BMC? Who is it? It is only the nursing staff. The IR, the sister and the ward boy who have gone closer to the patient, risking their own life. Tell me who is telling that they have done a great job. Nobody is telling. Majority of them are not telling. Okay, but it is they who have risked their lives, became COVID positive and treated us who were all COVID positive by coming closer to us. The doctor, majority of them, apart from ICU cares, majority of the other places where the doctors were on, calls or visits, they were sitting in their cabin and giving the instructions or doing telemedicine. I have done telemedicine for more than 150 patients in March 2020, in the first month of lockdown. So it's like that, that's the truth. So infrastructure software requires expenses which can come only from the premiums collected. So there is some profitability definitely. Claim ratio, as I told, is important for such profitable footfalls. For hospital, it will obviously be a profitable thing if we start taking cashless and insurance patients, because it can increase the footfalls. And for individual doctors running hospital, they need to make profits. It is a very simple calculation. When I had invested in my laparoscopic equipment way back in 2004, the cost was not more than 10 lakh. Today the cost of the same laparoscopic equipment with upgradation is 50, 60, 70, 80 lakh. So if I have to upgrade, there has to be some sustainability. Nobody wants a Mercedes on day one. Everybody can run around in Maruti, but Maruti also has to be sustainable. Now here what I'm saying is that this is my triangle of the entire healthcare scenario in India or internationally also. There is an insurance company, there is a patient and TPA. Ideally, the patient is the focal point around which everything rotates. But for me, it is the doctor and the hospital which is the focal point, because without their own existence, the insurance companies are nowhere. And it is the hospital which is giving the credit to the insurance company. It is not the insurance company who is giving the credit to the hospital. So this is the market scenario. These are some figures way back in 2000. I'll come to the 2022 figures also, but these were the figures around in 2015 about the market size of health insurance, which is all in terms of crores. And you can see the exponential growth. Total revenue forecast. This is all 2015. I have given this slides to just compare with the current scenario. So the 2022 slides are just. This is again my value chain. Who are responsible, what position they hold: IRDA, payers, intermediaries, providers, insurers, customers. And these are seekers and literacy rate and all basic data. I won't go into the details of this. Population ratio, age group. This is my 2022 scorecard. If you can see that the general insurance, which is the PSUs, their market premium collection and their growth rate, and you can see the standalone private insurance company where it is growing. Okay. And you can see the stakes insurance company wise also. Where do the government insurance companies stand, and where is the growth of the private insurance company? So slow and steadily everything is going to move towards private. How, whether it will be a public-private partnership or it will be totally private, it is difficult to analyze right now. Thank you.
Founder and Chief Nutritious Health Mantra, and may we have Dr. Fareed once again to honoring the most trusted weight loss and medical condition expert in Mumbai. David, she's an integrated marketing and communication planning expert, and the topic she will speak today is for integrated marketing and communication plans. Thank you.
Very good afternoon to everyone here. We really had a very educational talk when I was listening. I'm a non-medical part of a hospital. So this was a lot of knowledge that was shared today. So I would firstly thank all the speakers who really shared wonderful knowledge. So now what I'm going to talk is the part of every hospital's, rather every institution that is required as well. And that is communications. When I say communications, for me communications is not just one part of it. But if you see, during the COVID, we all understood one thing. Only one person cannot perform, be it giving a service or be it talking to the people. We couldn't say that, the best of the print media at those days were not performing. But if we saw digital, like wow, everybody were like all over the digital, be it video consultations, be it your Facebook, be it the Facebook Lives. I mean, I myself have conducted almost 30 episodes I have moderated in Facebook Live for different doctors, the stalwarts in the industry. So, in the end, you see that there are many types of marketing that is a part of spreading awareness talking about your product, talking about your brand to the people. But they all need to be integrated. So that is the reason I've come up with the topic, integrated marketing communications. Why, when, and how. So firstly, I will speak about the types of marketing communications that we generally, most of us are using. First is the print media. So when I say print media, it is your newspapers, it is your TV channels, it is your radio channels, it is the big billboards. They also come with their own benefits. Now what are the benefits of a print media? I mean, most of you, a doctor, when he sees his article in the category A, like Times of India, he'll be like, oh, I was seen yesterday in the Times of India. So he's very happy about it. Why is he happy about it? Because the print media, the Cat A media, gives the boost to the brand. Secondly, it is attacking and seen by most of the mass audience. So it is not only one person who is going to see it, the newspaper is read by so many people. When a doctor has an interview in the health show of a TV channel, he's very happy about it. I see them promoting, on their Facebooks, on their Instas, and now there are so many reels, short clips are promoted. So again, if you see, they are integrating it. Third thing about the ATL or PR is it defines the brand standard. When you see a brand always publishing in the category A media, you say, oh wow, that's a big brand. Oh wow, we saw a full page ad of it. So you start perceiving that brand as a big brand. Be it healthcare, be it non-healthcare. That is the perception of the brand that is made by the people. The fourth is talent acquisitions. Now when I say talent acquisitions, what is it? When you're working in a company, I have been fortunate to work in one of the best healthcares, Asian Art Institute, Fortis Healthcare, IHH Healthcare, which today contributes to Fortis and global hospitals. Plus today I am with Just Look, one of the brand which has 50 years of legacy. So when we are there and we see, our doctors have spoken in this media, we've got the articles, so we feel very proud about our brand. So that is where you get good talents. So other hospitals talk to us, oh, we saw your doctor at this brand, what was that, what was the article all about? So it gives you even good talent acquisition. So this is all about ATL, this is all about the media which is expensive as well. So moving on to the next type of marketing. Digital media. Favorite, liked by everyone. I'm sure all of us are on Facebook. Anybody who's not on Facebook can raise your hand. Oh, there's one. So anybody who's not on Insta? Yep. Okay. Anybody who's not on LinkedIn? So if you see, the majority of us are there on these platforms. Why are we on these platforms? Because we know all of us are connected here. In LinkedIn, you know that, oh, this person works here. Supposing you have some inquiries to make, you can directly connect with them on the messages. Facebook, you come to know, like I take care of the hospital Facebook. So I will put awareness things. I will put things like what has happened in the hospital. So people are aware of what's happening. Now what is the best part about digital media? The digital media is measurable. When I make an ad, I create an ad for a digital platform, I can keep my audience. Supposingly, if I'm doing an ad for a liver transplant, I can decide the location which has to be there, where I can see the liver transplant patients are there. Why? Because, maybe because of the obesity in that area, maybe because of alcoholic more in that area. So that's how you can target your audience. The age group. Why do you set an age group? Because a 7-year-old cannot take a decision in the family. Nowadays you see even 12-year-old on the social media, but they cannot take a decision in the family. So you will obviously target an age group of say 25 years to 65 years. So what I need to say is, simple thing, the advantages of digital media is, it is measurable. You know how many people have viewed your ad. You know how many people got engaged to your ad. You know how many people liked your ad. You know how many people responded to your ad. You can decide your audience, and it is extremely cost effective in comparison to ATL activities like I mentioned before, the print media, the TV, the radio. This is extremely cost effective. The third form of channel is the internal branding, and I love this part. Because any place, I mean most of us may be from hospitals, different organizations, but you all believe that your internal premises has to look good. They need to be talking about the brand. So when they talk about the brand, what is the most important thing in an internal branding? It is the tonality of the talk. What are you talking to your patients? Today we have different forms. We have things like banners, we have posters, we have standees. Now there are digital standees where you can put small videos, you can put so many things. So you like seeing it. When you enter a place, like for example, if I'm entering a skin clinic and I see all around, beautiful faces, a lady with a beautiful skin, I must have gone for a peel. But I would go inside and ask the doctor, can I do some laser? How is that laser going to affect my skin? So what happens? An internal branding gives you an additional client because he or she has seen it. So internal branding is very important. The fourth, and again an important, which we missed during the COVID times. The COVID times started with online activities. Then it was when the COVID was on the unlocking period, we had hybrid activities. But tell me, we all love the on-ground activities, isn't it? And that is one of the reasons we all are here. I'm sure everybody agrees to it.
Yes.
I can't hear. Yes. Oh wow, now I can hear. So you have community camps, you have corporate camps, you have in-house celebrations, you have award functions, you have walkathon, marathon, cyclathon. Like in the month of September, I did something called as a beach walkathon in Virat, in Arnala. We did it in awareness for, the World Heart Day, which was on the 29th of September. So these are kind of activities wherein you bring people together. When you bring people together, there is an awareness. And the people of like mind will come together. Now, this 50, 60 people sitting here, today what we are listening, we will go and share with other colleagues of ours. I mean, today what I heard about insurance, Dr. Gandhi, it was amazing. There are so many things that I could understand. Though I am a part of a hospital, I must have never gone for it because it was never required. I mean, Jyoti David is not called on the TPA counter. She's a communications head. But it was so knowledgeable and we are definitely going to go and share it. Similarly, today what I'm talking here, what I'm sharing here, we will think about it. And that is where the similar minds come together during an on-ground activities. But is this all enough? No, it is not all enough. One by one, it is not enough. What you need to do is why, when, how, integrated marketing. Now, what is integrated marketing? I will give you a small example. While I was working with the IHH Group, Global Hospital, PARLE, Mumbai, Mr. CEO Dr. Vivek Talalikar told me, Jyoti, we should do something for stroke. So I asked him, I said, sir, why stroke particularly? He said, Jyoti, today's stroke is, there are people who may die of stroke. But when a person is the earning member of the family, he gets a stroke and he is paralyzed. You think of the family, what will happen? The family is suffering. The children may have to give up their education if he is not very earning. Eventually what suffers? Your national economy suffers. So I came up with a solution. I said, sir, let's do a campaign that will be #NoStroke for me. So why preach people that you should not get a stroke? First try on yourself that I should not get a stroke. So we took a 3 months to planning, and that is what I said, the strategy. It has to be 3 months in advance. Why did we took 3 months? Because October 28th is the World Stroke Day. So we thought we will do a campaign for almost 4 months, create a lot of awareness, and then we can do a culmination activity, which would be an on-ground activity. And we started making educational videos. We started posting testimonials of the patients and their relatives. Because when someone gets a stroke, it is the person near him or her who should recognize, oh, it's a stroke. Be fast, that we keep telling. So we did a lot of things around be fast. We brought out the patients to speak. We brought out the relatives to speak. Then we thought this is only not enough. We need to also speak to the print. So now while we speak to the print, it is a PARLE area where we have a lot of Marathi speaking crowd. So we thought of integrating it with Marathi newspapers. We brought few articles out there. These two was done. We also did a radio campaign which said, hashtag no stroke for me, issued in public interest by Global Hospital PARLE Mumbai. That was done. We did Facebook Lives. I remember I was the moderator with Dr. Shirish Shastak, who was a strokeologist for the last 30 years. So he has seen only strokes for the last 30 years. He could tell people what is the kind. There are even silent features about the stroke, signs. All that was explained to people. Now in the end we thought now we need to do something even bigger. So what we did is, we spoke to the police department. And why did we select the police department? There was a reason. Most of us, see the movies and हम देखते हैं पुलिस वाले बहुत corrupt होते हैं. फिर हम देखते हैं पुलिस वाला कोई dashing सिंघम बन के घूम रहा है. That is not the real life. The real life, when we had talks with police officers, we understood they don't even have a time. They don't know when they're going to have the second meal. कुछ नहीं मिला, बड़ा पाव खा लिया. चलो पेट तो भर गया. अब एक बड़े मिनिस्टर साहब आने वाले हैं, चलो रास्ते पे खड़े हो जाओ. 48 घंटे से बंदा रास्ते पे खड़ा है. अब ये क्या ही सोचेगा स्ट्रोक के बारे में? Because he has to earn his living. So we thought of doing something for them. And that is where we came up with hashtag no stroke for me, and we spoke to the Joint Commissioner, Mr. Vishwas Nagre Patil, and he agreed to it. So we did an on-ground event where we had Mr. Vishwas Nagre Patil coming, and we also had, the most favorite Marathi actor, Ashok Saraf. And we had almost 1,000 plus police officials attending the program online. And this was nothing but to create stroke awareness. And believe you me, in the span of 4 months, code white is for the stroke in all the hospitals. And we saw sudden jump in the number of code whites. There were times when, the patient has come to the emergency, he does not have a stroke. It's okay. It's okay. He can go back with the preliminary treatment. But at least he's not had a disability. So what I understood in the end of it, that integrated marketing could create awareness to all the class of people. From a person who is not on Facebook, to a person who's only reading the newspapers, to a person who understands only Marathi to read, to a person who's English speaking, to a relative who's taking care of his elders in the family, everybody could do it. So this was the impact. And that is why today I decided that I want to speak about integrated marketing. So that we all think that we have to make some mix of it. Now, when I say complete preparation of all the elements a month prior, when you are a month prior starting the campaign, you need to have everything of all the channels, all the places that you're going to do. And in the end, tactical implementation. When I say tactical implementation, what is it? Supposingly, today I am in Mulund. So I have to select which is the newspaper that is going to speak directly to the people living there. Is it going to be the Times of India? Is it going to be Mulund News? Is it going to be Voice of Ghatkopar? You have to decide. So that is where the marketing communication person comes in picture. Now every hospital also has internal screens and stuff. So put there some videos which can speak about the disease, which can create an awareness. We all have wonderful doctors, experienced doctors sitting in the hospital. If we request them, believe you me, they can give us such good, wonderful tips which you and me have not read in Google. Google does not educate you everything. So all these things. So here you can integrate your internal branding, you integrate your Facebook, you integrate your newspaper channels. That's it. You will have a wonderful result for it. And if you all can try, if you wish, with small things. You don't have to invest big. Invest small. But decide you're talking about what. Like if I'm talking about aesthetic, beauty, I should never miss Insta on the Facebook chat, on a social media platform. If I'm talking about, health, if I'm talking about a healthcare package, I should never miss, the health packages, never miss Facebook or Insta. So you have to decide the mix what you're going to do. Believe you me, it will give beautiful results. I have seen it, and that is one of the reasons I'm sharing here. For me, this is a share of knowledge. So I end saying just one thing. Let's integrate marketing communications. Neither is print strong, nor is social media strong, nor is your website strong, nor is internal branding strong, unless they all come together. Thank you so much for listening. We so appreciate it. Firstly, if you ask me, I will take a decision, sir, depending on the product or the service what you're going to talk. That is very important. Like I mentioned, if I'm talking about aesthetic, if I'm talking about skin, I would prefer more Insta and Facebook. I will also look into my internal branding of the clinic. Because if I'm having a lead who's come to me and that person is not seeing anything visually good, so why would I go to a place where there is no beauty? I would prefer going at a place where there is beauty. Plus, also, what is your area where you want to do it? Like for example, if I'm talking about liver transplant, which I have worked widely in global hospital and now in Jaslok as well. So what happens here? You have to decide which is the area from there the footfall you are expecting. It equally matters. So use the print media accordingly. Though I would say social media is more fast to reach, but if you have to create an impact, you do need the print media. You do need to take your doctors to the, TV channels. Why do you need to take them? Because others are doing it today. It's a competition. It's no more just well-being. It's a competition. We all agree. Like Dr. Gandhi said, all TPAs are fighting amongst each other. Bhaiya, hamara le lo. It is that way. So it's a competition. So we have to, and we also need to have a competitive analysis. Before making any plan, have an analysis of your competition. Because there are times your competition is doing something better and that is giving them good result. Copy करने में problem नहीं है अगर result अच्छा है तो. I feel that. And after all this is done, please remember, when a person is entering your institution, what is the tonality of your staff talking? Very important. I must have not mentioned in my slide, but this is something I have felt. Like when you enter an hospital and the security tells you, Namaskar madam, aap bataiye, aapko kya help chahiye? You feel good. You are having your sick mother with you and you get a wheelchair immediately. You are happy. When you are sitting, the doctor has not come. Why? Because the doctor or the surgeon is busy in a surgery. What do? You have somebody sitting there pleasantly and telling you it's going to take time. Don't you feel good? I really want to know, don't you feel good? If somebody is telling you it is going to take time, sir, madam, but the doctor is coming, you feel nice. Somebody coming and asking you, sir, would you like to have some tea? Would you like to have some water? Your ailing mother is with you and somebody says कि आपके मम्मी को कुछ चाहिए, उनको हम थोड़ा टाइम लेटा दें क्योंकि डॉक्टर को आने में समय लग रहा है. You feel good, right? You have a small child with you and he's crying. He's pulling his hair and somebody says, Madam, इसको एक chocolate दे दे हम. You will feel nice. So this is equally important. So the staff who's there on ground also need to be always trained. And while you put an advertisement, always make a call and check who is picking the call and what are they talking. Suppose somebody says, oh hello, बोलिए, नहीं है, चलो, हाँ, ये चल रहा है, आपको चाहिए ये offer तो आप ले लो. End of story. Believe me, the client is not going to come to you. But the same person tells you, yes sir, good morning, how may I assist you? Yes, yeah, we are having this offer and this offer is going to benefit you so much, believe me, you're happy. And this is a responsibility of the marketing communications person. I mean, when I release an ad, I sit with the people. I call them, I make mock calls. I tell them, you speak, you take me as a client, you talk to me. Because that's how the money that you're investing, look, in the end, we all are investing money and we all want return of investment. Am I correct? Nobody believes just charity. You need to run your organization. You have overheads. So what do? So you need to have a trained team who can help you with this. So sir, completing my answer, you will have to actually think what is the product and service and accordingly mix that. Like for example, if you're in Pune, you have to check, sir, which newspaper will help you. But social media, you should do, sir, because today everybody is on social media. Google reviews, you have to do. Because today, what do you do before taking a product? You're checking the review. Are we checking?
Yes.
Yes. So we are checking. And that's...
Advertisement in media and everything.
Yes, sir.
What's the legal aspect of a personal level going into an advertisement in a media like Facebook, WhatsApp, etc.? Because doctors are not allowed to do advertisement. So what is the legal aspect of it? Because everyone, I don't know, everyone is aware of it or not. But legally, you cannot say, you please come to my clinic, this is my timing hour and etc. etc.
Absolutely.
So it is very difficult to how to advertise it without consideration that you are getting involved in a legal aspect of MCI, Medical Council of India. It is very difficult. So how to go about it?
So, friends, the advertising council will come behind you and say, "Batao." So what you need to do is, sir, create awareness. Use a campaign of awareness. Like when I spoke about stroke, we never told anybody, sir, that come to global. What we said in the end of the video, I would really like to tell on this context. We said, if you see a stroke, reach your nearest hospital. The hospital is having 24 hours neurologist on call. The hospital having 24/7 imaging facility. And the hospital having 24/7 cath lab facility. So what has happened is, sir, I have never told that you come to global. Never told. But I have told what they have to do. So person, and I am advertising only in the 10-kilometer radius here. So what happens? The person who's at 10 kilometers is going to come to me only. Similarly, sir, whenever you take any kind of ad, never say come to me. You will come under a scrutiny. But if you say, whichever specialty, sir, you are in, you make awareness of it. Like today, you will start seeing in Just Know Facebook, if you go, you will see a winter series awareness I am doing. So in winter series awareness, I am going to talk about cardiac, I am going to talk about stroke, I am going to talk about respiratory arrest. This will be under the emergency banner. So eventually, I am telling that if there is an emergency, come to this. So similarly, sir.
Because the Google reading has increased within the last 3 years of COVID. Public को कुछ काम धंधा नहीं करना है, Google ही पढ़ा. I don't know all the doctors who are aware or not. And they hit the head like a mad, by which you get irritated at the end of 5th question, 6th question.
चार्जर मोड, बाहर बोर्ड लगा तो Google नॉलेज है तो ज्यादा कॉस्ट लगेगा.
नहीं, हमने लगाया महावीर में. Mahavir is a charitable trust where we have written our prescription 300 rupees. Your questions, your answer, your Google doctor answers 500 rupees. Your question, your answer, and your treatment 1000 rupees. So, in that case, some of the patients will write very bad review. Now, how to counteract that bad review? I don't know. Everybody has experience or not. One of the bhajiwala, he came to my clinic. See, he was so poor, so I gave him my medical representative number. I am a nephrologist. So I gave his number so that his all injections and everything will get discounted of 25% to 30%. Now, either it was been instigated by some other doctor or what. Doctor को उसका commission मिलता है, उसका ही दवाई लिखता है. ये doctor बहुत खराब है. So 0/5. Now, how to counteract that? You give me answer.
I'll give you an answer. So now, this is a problem with social media.
It is 100% because your colleague. See, हमारा डॉक्टर कम्युनिटी में ऐसा है, टांग किसका खींचना है ना तो everybody is there.
सर ये हर कम्युनिटी में
हाँ,
हम भी फेस कर रहे हैं.
how to counteract this, that is the important.
I'll tell you, sir. So now, when we started for the first time a Facebook page, in a hospital, I'm talking about 7 years back, everybody had one thought, यार ये तो दो-धारी तलवार है. यहाँ पे पॉजिटिव भी आएगा, नेगेटिव भी आएगा. कोई श्योरिटी नहीं है. तो नेगेटिव आया तो क्या करेंगे? This was how the social media actually started. Social media is a strength also, and it is a problem causer also in disguise. Okay, as you said, the competition can write negative about you. So, sir, if you tell me that मेरे पेज पे इतना negative है, first I will speak to the negative review person. बस आपका problem क्या होगा? He will tell. Now, sometimes what happens? You must have referred him to a second person. Your treatment was amazing, sir. In this context, your treatment was amazing. But you and me today don't know how did the second person behave with him. So, first, to take a precautionary step, whenever you are referring somebody to a second person, be double sure that the second person is correct. Because you never know what the second person has spoken also. Because everybody has a loose mouth. And by zaban hai to bolna hai. It happens. Absolutely. Well said, sir. So, sir, now supposingly even after talking to them, you are not getting a correct review. I would tell you, in such a situation, speak to your 5 patients who are happy about it. Tell them to put a review. His review will definitely go down. So when somebody is checking again, he sees the positive review. So that is okay, but never go to remove the review, because what happens, you, me, everybody understands that nobody is perfect. There will be always a problem. Absolutely. So, sir, never think कि मेरा 100% 5-star ही होना चाहिए. Because when you will show everything is a 5-star, no sir, a person like me who's a marketing geek will say, boss, यहाँ पे तो problem है. यहाँ तो कुछ तो है. I know the marketing thing, and most of the people know the marketing thing. See, the one who's coming as a patient is reviewing and they know what they are reviewing. So it is okay if there is a negative review. But if you put 5+, who is a positive review, people know that also. So as a layman, even I know, हो सकता है इसका कुछ problem हुआ, हो सकता है इसकी treatment में problem नहीं है, but इसको पैसा नहीं देना हो. Because today there is an impression when a patient comes to the hospital, उसके लिए डॉक्टर भगवान होता है, भगवान. जब वो हॉस्पिटल में रहने लगता है ना, वो कहता है डॉक्टर मेरा दोस्त है. जब हाथ में बिल आता है ना, तो सबसे बड़ा दुश्मन तो डॉक्टर ही है. He forgets कि भाई उसने मेरी जान बचाई थी वो टाइम पे जब मैं इमरजेंसी में आया था. So that's a fact. You cannot change it. But the only thing is that put the correct review. Yeah, every part of advertisement will have its pros and cons. But you cannot stop advertising. You cannot stop talking about your work. A very old thing which said, we used to always say word of mouth. I have patients from the word of mouth. Today, how is the word of mouth being spread? It's nothing but the patient testimonials. What you put on your website, what you put on your Facebook, what you put on your Insta, you believe it. When a doctor says that this surgery is so impactful, you get the knowledge of it. You get the knowledge of the surgery. But where comes the belief? When his one patient tells you, "Aap yahan kar lo," safe hands hai. Even if he has read the Google review, not read the Google review, but when somebody else tells you, it is the safe hand, you want to go for it. Because for you, for yourself, for your loved ones, you always want one thing, and that is safety. So whenever we are into advertisement, always remember, clinical excellence and patient centricity has to be pushed first. So what happens? That is your surrogate way of talking. You are talking about clinical excellence. You are talking about patient centricity. Believe you me, these advertisements will have no legal issues. Plus, these advertisements will have better walk-ins to you, who are quality walk-ins. Then the ones who are just coming and sitting, as you said, with those lists. Iska kya? Ye nerve hua ki nahi hua? Though people read it, it is a fact. My mother-in-law was supposed to undergo surgery for her trigeminal. We first went to the Google. I mean, even after me being in such good hospitals, I have worked. Still, we want to know what it is. Then I spoke to a doctor. I said, sir, karna chahiye, nahi karna chahiye. He said, Jyoti, tu bata problem kya hai? So, ye. Bring it to me. So, I know this doctor is the best in his work. So, why do I know he's best? Because he's always spoken about his numbers. Because I have seen his patients talking about his good work. I knew 4 neurosurgeons, but I went to one because I knew him, because I knew his work. Simple as that. Patient testimonials again plays an important role to get better reviews and to make yourself to have that positive image. Negative will come. You cannot stop it. It's always positive and negative. But push your more positive. Yes, sir.
Will you please highlight something about the legal standing about this whole matter? What sort of legal standing it has?
Sir, I may not be able to give a perfect answer on it.
You can be closer to that.
I can be closer to that. I will not say that whatever I speak just now about the legal standings is going to be the perfect thing. Because I am not a legal person, I am a marketing person. So when I say legal, look, if a person has to create a problem to you, okay, he will first try and get the paperwork done. And in one of the paperwork, what he can do is, if I have said that this doctor is bad, okay, this doctor treated badly, for example, I will go to 10 more reviews and check. Inka negative reviews kitna hai. With those negative reviews, he can create and just say ki, itne negative reviews hai, but that can do nothing to the doctor legally. Nothing to the best of my knowledge. It is only a paperwork. It is only another, paper that is added to his affidavit. That's all. It cannot legally harm a doctor. To legally harm a doctor, there are so many things that he needs to have. All the documents in place, which really show that the doctor has done something wrong, which rarely happens.
And at the same time, sometimes what happens regarding communication skill, any of the doctor also get irritated, and then they write the So, will you? I will contact you later. Will you have some classes for communication and how to keep mind cool?
Sir, I would love to do it.
Everyone get irritated when they are going to ask 6 times, 7 times, 10 times.
For listening so patiently and sharing your views. Thank you so much.
Thank you, Milton. May I have Dr. Gandhi once again on the stage to present the awards. For the most trusted fitness lifestyle consultant of the year, we have Mehul Lal, founder of Swasti, the fitness nutrition studio. Let's hear it loud. Dynamic Healthcare Leadership Award, Cardiac Surgeon, Dr. Pawan Kumar, Senior Heart Surgeon at Leelavati Hospital, Mumbai. Can we have you, sir? Moving on to the next award, Iconic Healthcare Leader Award for Pediatrics, Dr. Sandhya Satish Kharse, ex-Dean, Rajiv Gandhi Medical College, Chhatrapati Shivaji Maharaj Hospital, Kalwa, Thane West.
Good afternoon to all of you, and I'm highly honored and privileged to receive this particular award from Leadership Business Solutions and all the partners, and particularly Dr. Manoj Gandhi sir. For me, I should say that this is not a first award or anything of that sort. This is my 40th award and 4th award in this year. So, for me as such, receiving an appreciation from an audience here, I know hardly 1 or 2 people here actually, and all are totally new to me. So this particular platform, which has given us a recognition and which has given us this particular award, it's a great award for me. And I was very happy to listen to the deliberations also about insurance, about madam's communication. I would also request Jyoti Madam to come to our hospital to give us a communication skill awareness and lectures to our people, because we are in the government sector and we still face a very hard problem.
Happy to connect.
Yeah, and once again, my sincere thanks for all the arrangements which has been done by this group and calling me here and inviting me to receive this particular award. Thank you so much, and my best wishes and blessings to this particular group to encourage more and more people, because anytime when you receive an award, it's an honor, it's an appreciation which you people have given to us, and it motivates and it inspires us to do something more, something better, and we can do something great as such. So thank you so much.
We also have Dr. Raksha Shende, Consultant Pediatrician, Arogya Kunj Polyclinic. Okay. Moving on to the next award, Most Trusted Hair Transplant Clinic in Mumbai, Dr. Vinod Sonavne, Hair Transplant Surgeon, Bloom Hair Transplant. Women Super Achiever Award, Mental Health, Dr. Mangal Kadin, Clinical Neurophysiology and Advocacy in Mental Health Law, Founder, Mental Health Aims, Director, DRMK Memory Foundation. Dr. Darpan Kaur, Professor of Psychiatric, Department of Psychiatry, Mahatma Gandhi Mission Medical College and Hospital, Founder and Consulting Psychiatric, Sadhguru Mindcare, Mumbai, Maharashtra.
So, my very big thanks to Dr. Fareen Khan and Mr. Azhar Faruqi. Right, and thank you for your organization for giving me this award, Women Super Achiever in Mental Health. So I'm truly very honored, and I think psychiatric disorders and mental health problems are highly stigmatized, but they are very much increased in the community, and glad that you have also felicitated psychiatrists and mental health professionals in this program. And I'd like to just dedicate this award to few people. First of all, I dedicate it to the Almighty God in all fundamental forms that He exists. I'd like to thank this award and dedicate it to my grandparents, my Nana Ji and Nani Ma, Mr. Harnam Singh Rati and Sumitar Kaur Rati. And I'd like to thank my mother, Dr. Mohinder Kaur Rati, who's a senior MBBS practitioner, and she's encouraged me to be a good doctor all my life. And I'd also like to thank my best friend here, Dr. Jyoti Kers, who's also a senior psychiatrist, and above all the patients and our colleagues that we work with, and patients and caregivers with psychiatric disorders and mental health problems. And as a doctor, I dedicate this award to all the patients and their caregivers. Thank you so much.
Iconic Healthcare Leadership Award, Orthopedic Surgeon, Professor Dr. Pradeep Bhosle, Director, Arthritis and Joint Replacement Surgery, Nanavati Max Super Specialty Hospital. Do we have it here? The next award, Quality Healthcare Leader Award, Radiation Oncologist and Genitourinary Surgeon, Dr. Trinanjan Basu, Senior Consultant Radiation Oncology, HCG Cancer Center, Mumbai. Going on to the next award, Women's Super Achiever Award for Restorative and Aesthetic Density, Dr. Kavita Kamraj, B. MDS, MS in Restorative and Aesthetic Density. Sorry about that. Is she there? Dr. Kavita? Okay. Going on to the next award, we again have the category of Women Healthcare Leadership Award. Diet and Nutrition Consultant, Deepa Nandi, Nutritionist. Deepa Nandi, Nutritionist. Consulting physician and nephrologist, Dr. Jayesh N. Desai, consulting physician and nephrologist, Ramakrishna Mission Hospital, Guru Nanak Hospital, Baba Saheb Gauri Hospital, Mahavir Medical Research Center.
Award I just give to my all patients and my all consultants and my resident medical doctor who has helped me to come at this stage. So this is not for me, this is for my patient who has come trust from 1985 till today. Thank you.
Physiotherapist, Dr. Ankita Asher, consultant cardiopulmonary rehabilitation specialist, cardiopulmonary rehabilitation specialist, physiotherapist, Jupiter Hospital, Thane. Iconic Marketing Communication Award, Healthcare, Ms. Jyoti David.
I think I spoke a lot, but I'm going to speak some more. बात करना मुझे अच्छा लगता है. So I thank the Generic Golden Aim Awards for choosing me and getting me this award today. At the same time, I will take this opportunity to thank all the stalwarts that have worked in the industry who taught me the knowledge that I could share today is just not in a day. In the last 23 years, I have learned from so many stalwarts, and I thank all of them. I don't want to take any names because I shouldn't think that I have missed anyone. And in the end, I will always thank my husband, who's always there to encourage me. I'm still there, holding the camera. Okay, I'm looking nice. Thank you.
Most preferred newborn and child clinic in Thane. May we have Dr. Namish Savaria, pediatrician, Dr. Namish Savaria, child and newborn clinic. Iconic Women Healthcare Leadership Award, Pediatrics and Neonatology, Dr. Varsha Pharke, Dean and Professor, Department of Pediatrics and Neonatology, KJ Sumaya Medical College and Research Center. Most Preferred Surgical Oncology Consultant Award, Dr. Vinay Deshmane, Surgical Oncologist, Breast Disease, PD Hinduja and Rich Candy Hospital. Iconic Healthcare Leadership Award Pediatric Surgeon, Dr. Jeevan Shankar Gowli, Consultant Pediatric Surgeon, Jeevan Pediatric Surgery Center. So maybe have some new words.
I'm really honored, Golden Name Awards, for recognizing me. In fact, I would appreciate that you are recognizing somebody from the private small nursing home sector who is trying to provide specialty services to the middle class, my small patients. Usually these awards are given to the people from corporate setups, government, public sector setups. I'm providing services for last 20 years for my small patients from middle class families at affordable rates. Thank you. Thank you very much.
Iconic Healthcare Leadership Award for Nephrologist, Dr. Raman Malik, Senior Consultant in Nephrology, Fortis Hospital and LH Hiranandani Hospital, Mumbai.
Well, I've been in medicine practice from 1972, maybe one of the senior most people here, 50 years down the line. It all started from Pune, AFMC, where I graduated, and thereon served in the armed forces for a long time. In 1991, I did the first, was associated with the first kidney transplant in the armed forces, the pioneer in armed forces. Thereafter, there was a pill, and I left this force in good spirits, became associate professor in FMC, but still I continued to move out into the corporate world, and now I'm associated with 3 hospitals where transplant is a foray. And now, after 50 years, I would like to do more of social, doing subsidized dialysis, subsidized transplant for the people who can't afford. I thank the organization, Dr. Fareen, Mr. Siddiqui, and their Energy Communications for this award function. And to all of you, I hope we can all achieve what we have got.
Thank you. It's an honor to have you, sir. Quality Healthcare Leadership Award, Orthopedic, Dr. Mihir Avinash Ranavre, Orthopedic Surgeon, specializing in joint and spine, regenerative medicines. Thank you, Dr. Gandhi. Now, may we have Dr. Sandhya Katse to present the next awards. Most Trusted Healthcare Leader Award, Cosmetic Homeopathy, Dr. Abhay M. Chedda, Director, Center of Cosmetic Homeopathy.
So, about this particular health sector, I would like to say one thing. The role of a doctor has got degenerated from a doctorship
to physician to now Mr. And his role has become more like a drugging. So patient comes to a doctor to take drugs, and the doctor thinks patient has drug. And beyond this, we must go where we need to see the holistic solution for the patient from his lifestyle, the way he lives, the way he thinks, and then giving him the holistic solution coming from the purpose of life and giving him the solution through art and self of living. So we really require a real health reforms in this sector. Thank you.
Thank you. Dynamic Healthcare Leadership Award, Dr. Ashwini Jogade Pandhari, Medical Superintendent, Nanavati Max Super Specialty Hospital. Most Trusted Lifestyle and Sports Nutrition in Goa, Valerie Shah, Sports and Lifestyle Nutritionist, Kasha by Valerie Shah. Women Super Achiever Award, Diet Consultant and Nutritionist, Dr. Sabiha Siddiqui, Diet Consultant, SNDT University.
Good afternoon to everyone. Thank you, AIM Conference, to trust me and give this honor. I would like to thank Dr. Farha Khan and Siddiqui sir. And of course, after that, my most, I can say, supporter lady, my mom, Shabnur Siddiqui. And after that, all of my patients who trust me, and because of them, I am here. Thank you so much.
Thank you. Thank you so much. Women Super Achiever Award, Weight Management Consultant and Nutrition. Sorry, nutritionist. I'm hungry, I'm sure. Shubi Hussain, founder of Health Sanctuary brand Health Sanctuary. I'm definitely hungry. Oh, we don't know. Iconic Healthcare Leadership Award, Top 3 Gynecologist for the year 2022. Dr. Sarah Zedi, Gynecologist and IVF Specialist. Indira, IVF, Dadar. Okay. Dr. Sumitra Bachi, Dr. Munira Ansari, gynecologist and assistant professor in St. GS Medical College, KAM Hospital, TNMC, Nair Hospital.
I would like to thank Dr. Farheen Khan, Azhar Faruqi, and that Golden AIMS Award and Almighty God, because I was shocked what this award is about. Then I communicated the people, they told me it's a research team which has researched. And I was the only dedicated COVID hospital in the first wave. There were no other hospital who were accepting COVID patient, and our Nair hospital, the wards used to be full, the ICU used to be full. And I know the panicky with the patients I've gone through, even on my family member, I was finding it difficult to get the bed, ICU bed for my own cousin. And then I have to admit her in the WOCAR. And I was the first person who did the first COVID section for a home minister relative. She was admitted with us in the Nair. So I've seen the life, the hi-fi people were admitted in Nair when we are actually catering the lower middle class patients and poor patients. But that time, people were just wanting a bed, ICU, ventilator. They were not looking at whether it's a Nair. Otherwise, people think, no, why we will go to Nair? But I've seen people have come from home minister relative, they have come to Nair, and we have treated more than 100 deliveries of COVID pregnant women. And Alhamdulillah, even I was quarantined. When we were the front liner, I had 1.5-year-old baby, And I thank my husband, he has cooperated so much. And he said me, "Ki, don't worry, Allah is with us. So you do your job." And my report came negative. My mother was crying while you are working. I said, I can't refuse my duty. I'm answerable to God. And I remember people said it's the only class 4 worker who were frontliner. It's not the story. In Nair, all the doctors were. We have resuscitated the patients in your SSO OPD. In the ambulance, we have given ventilatory support. So it was a tough time, but Alhamdulillah, by the grace of Allah, we did a good job. And many of us went into depression. Many doctors were positive, they were admitted, their families suffered a lot. But you always get a reward, somewhere or the other.
Absolutely. Innovative Healthcare Leader Award, Gynec Laparoscopy Surgeon and IVF Specialist, Dr. B. Ramesh, Medical Director, Altius Hospital. Most dynamic Urogynecologist of the year 2022, Dr. Aparna Hege. Most dynamic cosmetic gynecologist and infertility specialist, Dr. Ruchika Bhandari. Do we have Dr. Ruchika Bhandari? Most dynamic gynec oncologist of the year 2022, Dr. Priya Ganesh Kumar. Dynamic Healthcare Leadership Award for Radiologist, Dr. Nitin G. Chaubal. Iconic Women Leadership Award, Hospital Administration, Hiral Sareen, Head Operations, Jaslok Hospital. Women Super Achiever Award, Healthcare, Dr. Mrs. Usha Sharma. Iconic Healthcare Leadership Award, Pediatric Gastroenterologist, Dr. Vibhor Borkar. Most Preferred Lung Specialist, Dr. Indu Bubna. Do we have you? Outstanding contribution in the field of healthcare, Dr. Samir Bhargava. Most Trusted Diabetologist in Mumbai, Dr. Kamini D. Lakhani. Women Super Achiever Award, Pharmaceuticals Quality Control, Dr. Archana Bahuguna, Topmost Best Homeopathy Doctors in Maharashtra, Dr. Fatima Mandusurwala, Dr. TrueCare Homeopathy, Dr. Megha N. Fare, Homeopathy Consultant, Dr. Megha's Homeopathy. Sure, we have someone from, for Dr. Megha on behalf of Dr. Fatima.
Boss.
Sure, please come, sir. This is on behalf of Dr. Megha Pare. Thank you, sir. Mumbai, 2017-2019. Can we hear it first? Sir, can we have you on the stage? Also to accompany him, his better half, Honorable Srimati Pooja Vishwanath Mahadeshwar, Corporator H.E. Ward. May we have Dr. Farheen Khan once again, please, to honor them. You say no, you keep on saying no, and I'll keep on calling you. So maybe also you're for Dr. Pranjala, proud daughter of Mr. and Mrs. Mahaleshwar. Let's hear it for them, sir.
मराठी हिंदी
जय महाराष्ट्र.
मी अत्यंत धावपळीत होतो. आज खूप लग्न आहेत. जवळजवळ 10 लग्नांना पोचायचं आहे. वसईला जायचं आहे, डोंबिवलीला पोचायचं आहे. अनेक लग्न आहेत. तरी म्हटलं जाफरबाईने खूप विनंती केली आणि आमचे जाकीरबाई उपशाखा प्रमुख आहेत. म्हटलं म्हणून ऑन द वे जस्ट तुम्हाला भेटावं आणि पुढे जावं. सगळ्यांना खूप खूप मनपूर्वक शुभेच्छा. नमस्कार.
Good afternoon, everyone. I hope you had a good meal, and we are here once again, pepped up to again appreciate professionals and offer them awards. Yeah. For the education sector, we have our first speaker, Professor Dr. Prakash Divakaran, MCom, MPA, PhD. He is a Pro Vice Chancellor at Himalayan University and a CEO Global Research Conference Forum. His topic for today is research, methodology, and ethics. May we have him on the stage, please. Professor Dr. Prakash Divakaran.
Very good afternoon, one and all. So I am very thankful to Madam. I forgot her name. There is a written Dr. Fareen Khan and Asar Faruqi. So we are meeting the first time. I think we have so many webinars we are attended, but this is the first time we are meeting. Anyway, thank you, Madam. So very interesting topic: research methodology and ethics. So after the lunch, how you are digesting with the research methodology, maybe you will think. But I am telling you, where you want to start a healthcare sector, even hospitality sector, or anywhere, when marketing things or automobile sector, anywhere, research is very, very important aspect. Whether you are doing academic research or whether you are doing marketing research. So whether you want to do, for example, even in a healthcare industry, or a utility store, or a spare parts store, or anything. So there you should have a study. You could not go and anywhere and you cannot start something of your business. Before that you should have a proper study, otherwise it will be a problem. So here we are discussing on research methodology and ethics. So research methodology you are aware about research, but ethics, so that both the things we are going to cover today. So what is basically research? So anything we are finding it out newly, that is also called research. At the same time, the available resources, refining again and getting into a new the theory or new existence or new comments, that is also called a research. So this is the basic thing of research. So I will go to other slide. So why do we do research? So UGC had given a mandate that every professor has to acquire the PhD degree, then only you are going to promote it into the next step. So I am going to do the PhD. I am going to do the doctoral program. So some people are doing like that way also. Rather than that, it should be a passion. You are having an experience into the same field. So you want to contribute and you are having a passion to do the research. So like that way, the research has to be done so that it will give good results. So then desire the face the challenge in solving the unsolved problems. So in your studies, in your area, there will be some unresolved problems are there. So that problems, you want to make new measurement on that, you want to add something on your experience, then also you can do the research. Then desire to be a service to society. So all the research, whatever you are doing, that should at least a part of that should benefit to the society. Whenever you are doing something, that is a new contribution and a new research, and that should be benefited to the society or anybody or related to that community. Then choose a subject. So how I'm going to choose a subject? Some of the time when we are as a research supervisor, when you are working, some students will come. So whereas title may kaise karo? Research. So then I will tell them why you want to do the research. So you don't know anything about the subject which you want to go to do. That means you are an MBA person, so you are doing something, you have done organizational behavior, you have done marketing, you have done so many things on the subject line is there, then HR. So you want to do a core area where you are having that interest and you are having the experience. Then based on your experience, based on your reading and that originality. So the important features of the research design are a plan, a strategy, and the time and the budget. You should always have a plan to complete your research. Similarly, you should have a strategy. Which strategy, which method you are going to do with the research. Then characteristics of research, that is systematic, logical, and empirical. Systematic means all steps must be interrelated to one another. All the steps we are carried out in the research should be systematically oriented. Then logical, that is some things we cannot give an answer, so then logically you can put the answer. Then empirical means conclusion should be based on evidence and observation. So whatever the research you are taking place, there should be some evidence to prove that my research supports like this way. Then what are the different research methodologies? That is based on information. There is always we will tell primary data, secondary data, there should be some structured questionnaire, then this questionnaire you have to circulate and get some data and all. So primary data means, for example, I will tell you, you know that census, the people will come to your home and collect some data. So how many father, mother, age, you have any elder, you are a younger one, and what are the things you are having, like that they will do some data collections. So directly a person come to your home and collecting the data. That is called primary data. So very simple. These primary data, now they have analyzed how, in particular area, how many people are there, and there how many male, how many female, how many kids, and the age group, and everything has been published in a journal or in the book or author's list or anywhere. Then you are referring that data. That is secondary data. That means something is already done by someone and it is published and it is readily available, then it is called secondary data. So when we are talking about the entire process of the research, so first you should have a title. So how you are going to derive the title? You have a problem, and that problem you are going to discuss with the people, or you are going to refer some literature reviews, and you will find out some similarities, and after the collection of that literature review, you will refine your title. Once the title is fixed, you can have some objectives. So why I want to do the research? Then to resolve this, you should have some hypothesis. Okay, so I'm very shortly telling. So the title is there, then you should have the objectives are there, then the hypotheses are there. Then you should have a research methodology plan. So how to go about? So maybe almost everybody is going for collecting the data, primary data, secondary data, both together and all. So after getting the data, you should have a plan how to collect the data. Then you should have a population. So where you want, for example, Nasi or Navi Mumbai or Thane or anywhere you want to go. Then there will be a public will be available. For example, BBA students behavior or a marketing students something you want to study. So then the Thane area, if you are selecting, so entire Thane area, how many students are going for BBA studies? So you have to collect all the students' data, you will get it. But you can go to everyone, each and everyone, no. So you have to take some samples. So samples also research methodology, there are some methods. So accordingly, you will find out a sample and then you have to approach the people to collect the data. Once it is collected, then you should have an analysis to the various methods. You have to prove that whatever the data you have collected is there. Then you should have the analysis, then summary, like that the research goes. So now the important topic we are coming as ethics. Everywhere ethics is there. For me, I am doing something now. So maybe it is right for me, but you are in a sleepy mode. So you want to sleep. That is your rightness on that occasion because you have to harvest now. Otherwise you cannot sit there more. But I have to talk. That is my duty, then I am talking. So similarly, but for me, what I am doing is right for me. For you, it is a boring, maybe research. I am not interested. I am coming here for awards, collection of awards. So similarly, the ethics is coming, then there should be different opinions. So in research ethics, there are very important things. For example, Dr. Farin Khan ma'am has done a research. After some time, she has published the research paper, her thesis comes as a book and all. Then one fine day, very near to one person or anybody has seen that and they are copying that. Some of the area and she must have done with 5 to 7 years work and she has done the summary. Then the summary is taking. That means results are there. And the entire copying of other thing. The words and everything will be different. But the result will be same of foreign can medals. So this is the way. This is the way that some people are doing. That means they will take the summary result from the foreign thesis and they are duplicating all the other things, introduction, everything will be different, but this will be common. So these are the things are happening and some of the things, when I am done a paper, so I will discuss to my colleagues, sir, I have done a research, this is my concept and that. Then, but I took some time for publication. Then they will listen this and they are immediately going and writing with the same concept. And before my paper, in one more international journal, the thesis is the paper is coming. So these type of happenings are there. So anyway, rightness or wrongness of a human act. Then the morality of a human act. Then it allows researchers and scholars to further educate themselves and monitor their activities in the conduct of research. So the ethics are concerned, there are some rules and regulations set up by the UGC itself. Similarly, all the educational organizations or the universities, college, whoever it may be. So either one more problem is there. If you have been caught for any act related to research, then you are spoiling your name. Similarly, your supervisor, your guide, or whoever is guiding you, whoever is contributing to that research, everybody's name will be spoiled. Then other thing, your reputed organization's name also will be spoiled. So before doing that, that is why you have to follow the ethics of that guidelines of the university, college, wherever you are working. So I think I have told you most of the things in that. So when we are doing some research, so it should not come as a harm's way. It should not disturb the person. For example, when you are collecting some data, you are going to a research or to a company where the company HR or the management has allowed you to do some research. So then you are going and interviewing the people. And after getting some information, you are coming and sitting with the HR and telling that person, that tall guy, whose name is I forgot, this name, that name, and he is telling a lot of things, criticizing about the organization. So these are the things you are not supposed to do. That person believed in you and shared some good information that may be good for the management to correct their mistakes. Similarly, you would got some information to complete your research. So you should have that courtesy not to disclose the matter which we are discussed with the people to collect the data time. Then ethics is not limited to the treatment of human and animal subject. It also extends to the underlying motives and moral considerations of the experiment. An experiment which is unethical as an idea cannot be considered ethical simply because of the research follows on ethical procedure. When most people think of ethics or morals, they think of rules for distinguishing between right and wrong. Which is right, which is wrong. But your university, your college, your organization had some value. Tata is having Tata Code of Conduct. So Tata, similarly Toyota is having. So every company is having their code of conduct. Similarly, universities also have. You have to follow simply that. And your UGC has given 30% of plagiarism limit. If you can copy somewhere, for example, you are taking some literature review, there will be always some plagiarism, right? You are copying something, but you have to give the credit to the person. If I am quoting somebody's work and stating to prove my thesis, then I have to give the credit to the original person who are contributed to the particular research area. Then most ethical should arise qualitative research. As the relation between the researcher and the subject is very closer, then these ethical issues will arise. Then a range of these issues, including the use of video, audio, and sometimes we are copying some graphs. Directly it is available in the net or somebody's books. So whenever you are copying that, you should give the credit. I have took it from so and so. There are some so many methods are available for and all. So accordingly, you have to give the credit to the person from which video I have taken, or which graph I have quoted, or which government publication it has been there, or any statistical information as such. So common ethical issues are one is confidentiality, anonymity, legality, professionalism, and participation. So openness, share data, results, ideas, tools, resources. We open to criticism and new ideas. So you are always ready to share the data with others. Similarly, somebody is telling them this is not good, or always the supervisor is there only to find out our mistakes. Only to find out our mistakes. So that is good. It is referring again. Sometimes we know what we did is correct, but however we have to listen to the supervisor. Then you will get a new result from that. So that may be good for the guide also, the researcher also. Then confidentiality. Then responsible publications. So responsible publication and all, why I am telling you, you are writing a paper and publishing it. So this is going to the net or going to a book as to similarly libraries. So whatever the data you are selecting and you are stating, that is a reference for other students. So if you are wrong, all entire people those who are citing, your quoting from your work will be gone into vain. So always whatever you are doing, make sure that you are doing the right thing. Then honesty. Honesty means what? My own work should be published as my own. Simple as that. Don't try to copy. Don't try to hijack somebody's work. If any case, you want to do some work, like somebody has done in North America, similarly something need to be done in Mumbai, then you are referring those details, how they have done the research and all. There is nothing wrong in that. You can do that, check that. Several research you can plan. But when you are writing something, then you have to use your own language. Your own language. Please remember that. That means you are writing your own language. No issues. Then integrity and carefulness. So responsible mentoring and respect for colleagues. Respect for colleagues means respect your colleagues and treat them fairly. Means somebody is asking, again I am remembering you, somebody is discussing with some research concepts and all, then you should talk to him nicely and didn't try to copy, or before publishing of him, you should not go and publish it. Then competence, legality, animal care, human subjects protection. I'm not telling all these things, explaining. And this is all are the research things in all about. So Why I'm speedily going that I know your mood to get awards, and the lunch is, I think, was so heavy. The only one thing was missing there, it is ice cream. Why they are purposefully not given the ice cream? If the ice cream would have done, you all are slept already. So any questions related to research methodology, that is why I have covered when you are, I have shortened some slides also. So if they are having any doubts, I can clear. Because the public, those are come over here, already done so many research. And very young, ignited minds, that means a young generation, those who are going to research is very less over here. So that is why I have arranged some slides. So anybody is having any questions, you can ask.
Yes. So myself, Dr. Megha from Education Department.
Yeah.
And I would like to emphasize on, like, there are descriptive and historical different types of methods. But nowadays it is a trend that mixed method technology, mixed method is used by many of the researchers. So how much authentic it is, or like how much it is useful to the society? Like, what is your opinion about this?
Yeah. See, the things again, once I started, I told that we are collecting data, primary data and secondary data. So, some cases, the primary data is sufficient to prove our research. Sometimes, secondary data is okay. But in some cases, we have to use primary and secondary to prove our concept. Similarly, in research methodology, anybody can adopt any type of method, they can mix it, there is no problem in that. But what is your objective? What is your hypothesis? That is being analyzed properly with any method. You are analyzed or descriptive or anything. The character study, for example, William Shakespeare, their character study is doing somebody is doing the person itself, sometimes act as a, what we call, forgot that word. He will himself comes in some of the character and try to talk about his opinion to the public. So similarly, for that you can find it out. So like that way, so many things can be observed and can be stated in your thesis. So these things is your own opinion, and your guide is accepting that. And if you are a reviewer, for example, after the thesis is being submitted, there will be 5 reviewers who are going to review that, and they are also accepting. Then it is okay, nothing to be worried about. But always remember that whatever the research we are doing, it should benefit to the society, or anything has to be exist, or else any new thing has to be added. If it is doing the purpose, it is okay. As far as I am concerned, if different opinion, you can tell.
Thank you, sir.
Thank you. Any questions?
Thank you. And now can we have Dr. Farheen Khan and Mr. Azhar Faruqi to honor you, sir? Oh, we have a question.
Yes, please.
As you said, there are different opinions maybe. Even some of the guide maybe accept if you are research, suppose there is a topic and I want to prove that method B is better than method A. But sometime what happened, after the correct research, it may be possible that my hypothesis is wrong and method A is again good for the than the method B. But as I think, it may be also a research, because you have proven that the method B is not good as method A. But for that purpose, the PhD is not awarded to that particular student. Is it correct, sir? As per your opinion?
Not at all. See, the thing is that when we are having a concept, so that concept, based on that concept, you are going with some literature review, and you are refining that literature review. That is called a research development committee meeting. So then you are proposing that this is going to be my title. Then there will be some negotiations, discussion. Why you choose this title? No, this is not correct as per the method. So you should have this on your mind. Okay? Once this title is fixed, then only you are going to allot with a guide. Understood? Yes. as per the rules of UGC is concerned. So once this title is approved, then you should have, maybe you have thought about something else to do. But this title, according to the title, you shall frame the objectives. Then always there will be some objectives. That objectives you should have some hypothesis. Okay, that is hypothesis again, assumptions. It may be correct or may not be correct. But you should have some hypothesis. So proving that there are some methods are available. Okay, once you are proving everything is not coming into the mark, it doesn't happen. Always it doesn't happen. So A or B you are telling. So once you are trying to prove it. For example, you are taking a population. You are going for a questionnaire with that questionnaire. How it will be, whether it is close-ended or open-ended, or however it will be. It should be a structured questionnaire. This structured questionnaire means why this is structured questionnaire. Whatever the objectives or hypothesis you are framed, you should get some answer. Based on that, you are framing the questions. So the people are answering. Some people are, no, I don't know. Okay, it is okay. But other people are there. So there will be some relevant answers. So based on that, you are going to analyze it. So you will get the results based on your research objectives. And your, otherwise also, you can prove that these are my findings. And there is a scope for further research. इतना ही मैं कर सकता हूँ. तो आगे जो भी कुछ करना है तो आप कर लो. You can tell that. So nothing to be worried about. There is no rejection as such will come. If that is in the final stage rejecting means you got a supervisor. Oh, you got a supervisor? Yes. Good supervisor or wrong supervisor? Good supervisor. If the thesis is rejected means your supervisor is not at all worth enough. Yes. But because he is there to guide you. He is there to guide you, because when we are some people I have heard that first they will go with the introduction. It is not like that. Introduction is the last one. You have to go with the hypothesis, objectives. Then you are having some hypothesis. Then you have to prove you got a result and conclusion. Then you are going to frame the first chapter. Then finally you have to write the abstract. Some people are thinking that first abstract, then introduction. It is not like that in research. Please understand. Like you are writing a book. So everything is finished, then only the abstract will come to the picture. Why I am telling you? Because when the research concept may change, methodology you have to change. When final the result is not getting, that is it. Okay?
Thank you, sir. Can you stay on the stage? Maybe have Dr. Fareed and
Haruki sir.
yes, Sir, I would request you still, please stay on the stage to present the awards.
Okay.
We have an award for the Iconic Healthcare Leadership Awards. One of the top 3 gynecologists for the year 2020-22, Dr. Sarah Zaidi, gynecologist and IVF specialist, Indira IVF Dadar. Come on, we just have a lunch.
Hi, good afternoon. Just a quick brief introduction about me. I'm a gynecologist and an IVF specialist. So I am deeply privileged to receive this award today. I believe success is actually making deep impacts on the people we meet and we come across. The more impact we make is the most successful person, personally and professionally. I aim to make more such impacts through my profession, touch more lives, and do the meaningful to this service that we are doing. Thank you so much.
Thank you. Continuing with our awards for excellence and leadership in education. Distinguished Educator Award, Dr. Alok Mishra, Vice Chancellor, Mewar University, Chittorgarh, Rajasthan. Do we have you, sir? Moving ahead, for the iconic education leader in Maharashtra, Dr. Ashish R. Panath, Director Innovative Incubation and Linkage, SMDT, Women's University, Mumbai.
Good evening, everybody, and thank you very much for calling me here and felicitation. I'm very happy to be amongst a very glorious, get together, and I must express my thanks because I learnt a lot in the morning session also, and being a person taking ahead innovation mission of Government of India, and we are having an incubation center, WISE SNTTW Incubation Center also at Santa Cruz. We are promoting exclusively women entrepreneurship. So that is a privilege to us. And at the same time, as Sir has said, that there is a need of a paradigm shift in the education and academics. I have witnessed the total transition of education from privatization of education till hybridization of education now. And now the thing of, as far as research is concerned, we have gone for the initial phase of research wherein we were intent to publish the papers. Now we need to convert wealth, research to wealth concept has come. So I certainly would like to contribute anywhere out for any kind of a improvement in the systems, and at the same time, special thanks to this Dynergic Golden AIM Award, because this is second time I have been given, but last time I could not make it. I'm sorry for that, and this time I decided to be there. Thank you very much.
Thank you, sir. Let me first call up Dr. Megha G. Gokhe, Principal, Shyam Narayan College, Dr.
Good evening, everyone. First of all, I would like to thank to Golden AIM Awards for recommending my name for the same, and it's defined that it is based on the research as such, and for looking for the research lectures are yours. Now, as for the NEP, it is coming next year itself, and we have to be on our toe to work on the research as well as the various things, new things, innovations coming in the education. And this is all what when we are getting motivated by the our own trustee Shri Rakesh Singh ji, and the whole education trust. We are having 21 institutions overall in Kandivali East. So it's a whole big group, and I am in the teachers training profession, and we are making the teachers which are going to make the students
ready for the society. We are having a very responsible job, and we need to be on our toe all the time. So I would like to thank and dedicate this award to my family, to my husband, to my son, and to the whole, our own college trustee as well as students and my whole TSCR team. Thank you so much. Thank you. Thank you, sir. Thank you.
Now, may I call up on stage Joseph Sebastian, founder, principal of Holy Angels English High School, Bhadar East. Thank you. Now can we have Dr. Mrs. Supriya Shri Hari Shridhaya, Principal Vivekananda Education Society College of Pharmacy. Moving ahead. Do we have her? Okay. Moving ahead, Dr. Ritu Indrajit Bhattacharya, Principal, Sasmiros Institute of Commerce and Science.
First and foremost, thank you very much for being here, all of you, and congratulations to each one of you. Each one of you is a winner here. And we're celebrating what all of us have done well in our jobs. So congratulations to everyone. At this point, I would like to thank my family first. My mother, who has always been very, very supportive. Me and my sister, both are academicians. We are what we are because of her. She's not with us today this year, but she watches over us. My husband, always very supportive. We say that a man needs a woman behind him to be successful. No, a woman needs a very understanding man to do what she does. Of course, my son, my biggest cheerleader. Whatever I do, whether it is good, bad, ugly, he always says, "Wonderful, mama." Keeps me going. And then, of course, my management. They've always shown a lot of trust in me. Whatever new ideas I went about with, they've always stood by me. They've always told me, go ahead, be with you. That is why I have been able to make this college, which is just 7 years old, one of the most sought after college in South Mumbai. Thank you very much.
Thank you very much. Sorry for your loss. And indeed, yes, it's the family that supports the women who achieve success. So congratulations on that. Can we have Dr. Mohan K. Kale, Principal, Konkan Gyanpith Rahul Darkar College of Pharmacy and Research Institute, Karjat, Raigad. No problem. We can take a look. He's taking on his behalf. A slight diversion here. I'm just changing a path a little for one of our honorable person here, Mr. Jatin Dhansukla Suratwala. He is from the estate business, okay, and he will take the order first. I'm sorry, it's just that he wants to leave. Thank you. Dr. Anna Pratima Nikalji, Principal and Professor, Wilson College, Mumbai. Let's hear it. Come on, people, I want you cheering them.
Good evening, everyone. First, I would like to thank the organizers of Golden Lane Conference for honoring me with this award. I'm Professor Anna Pratima Nikalji, Principal of Wilson College, Mumbai. College established in 1832 by the Scottish missionary Reverend Dr. John Wilson. I'm also the Secretary of John Wilson Education Society. Under the flagship of this, we have 11 total schools and colleges, including a D.Ed college at Pune and schools at Mumbai and Jalna. Regarding the Wilson College, Mumbai, it caters to a diverse class of students, underprivileged, marginalized, and we work with the principle of inclusiveness. And we have Andrews Vision Center that caters to 57 visually challenged and all the other students having physical disability. So we take special care of such students. We have a visually challenged faculty as well with us, who is a gold medalist. And another flagship or point is the Green Warriors and Nature Club, which are serving the society through its green initiatives, working for the sustainable environment since long time. We have from undergraduates, junior college and postgraduate, and we have the PhD center for most of the subjects in science and arts. And from this year onwards, we have been conferred the autonomous status by University Grants Commission and University of Mumbai. And I'm privileged to lead this college, and I congratulate everyone, every member present here today throughout the day and the fruitful deliberations that we have listened to. Thank you once again.
Amazing. May I now call Dr. Sirajuddin H. Chowgle, Principal, Maharashtra College, Mumbai. Do we have you, sir? Moving ahead, now I call up Dr. Ashok Damodar Wagh, Principal, BNN College, Bhiwandi.
Thank you very much to the organizer, Dr. Fareen Khan and Faruqi sir. And at the same time, congratulate to all principals who have taken effective principles in Maharashtra. Congratulate to them all. Thank you very much.
Thank you, sir. Yes, I can't still hear the claps. Can we? Can we have next Dr. Usha Iyer, ex-principal, SIWS NR College of Commerce and Economics and Srimati Thirumal College of Science. Coming up next is Dr. Kavita Lalchandani, Principal, Krishan Chand Chelaram Law College.
A very good afternoon to one and all present over here. First of all, I would like to thank Golden Aim Conference, Madam Fareen and Mr. Farooq, if I am pronouncing correctly, for honoring us with this award and recognizing our work which we are doing towards the society for the students and all. And I'm also congratulating this Golden Aim team who has organized wonderfully this event today since morning and it is still evening. And also would like to congratulate all the winners of this today's in this conference, having different categories for the same. And I dedicate this award to, first of all, definitely to my family, my husband, my son who is with me right now, and my father and mother. I also lost her this year only, and I think she is giving me blessings from there. So that's how I'm receiving third award in this year. So really I'm blessed with that. And I'm also thankful to our board, HSNC board, and our board having total 14 colleges and 10 schools and total 45,000 students under this board. And this HSNC board has 3 law colleges under Mumbai University and 1 more law school under HSNC Cluster University, that is one of its kind under state of Maharashtra. So that's how our board is working, and I'm thankful to my HSNC board for giving me this responsibility and having faith in me to do something for the society. So I'm grateful to each one of you. Thank you.
May we have Dr. Manju Lalwani Pathak, Principal, Srimati CHM College, Ulhasnagar, Exemplary Education Leadership, Dr. Sandhya Kulkarni, Chief Advisor, Hirwal Education Trust, College of Computer Science and Information Technology.
Good evening, audience. First of all, thank you so much, Golden Aim, for giving my mother. I'm actually taking this award and feeling a big. I'm very proud to have this award for her. Her name is Dr. Sandhya Kulkarni, and thank you so much for giving her such a prestigious award and an honor. Well, what to say? As a daughter, it's a great pride to have this in my hand. And Mom, this is for you, and we are very proud of you as a family. A little bit about my mother, rather. She has served for past 40 years in this field of education, and the one bold step of hers was at the age of 50, she moved from the well-established place like PARLE to a small town called Mangaon, and she set up an entire university, as in not university, college as such, commerce college, and she gave her participation in a small participation in developing that region with the students, with the community, and I think these are one of the awards which she has received, and we are very, very proud. I have my husband here. And Mama, thank you so much. Thank you.
Presenting the awards for the highly effective Professor Electrical and Electronic Studies, Dr. Anita G.S., Associate Professor, Department of Electrical and Electronics, RV College of Engineering, Bangalore. Highly effective Professor, Aerospace Engineering, Dr. Ravindra S. Kulkarni, Professor and Head Aerospace Engineering, RV College of Engineering, Bangalore. Moving ahead, we have highly effective TPO in Maharashtra, Professor Anmol Anil Karmarkar, Dean, Training and Placement, Julelal Institute of Technology, Nagpur. Sir, because he is one of us who's been here since 10 o'clock in the morning, waiting with patience, appreciating people who have been acknowledged.
Yeah, thank you very much for this appreciating word. Being a DPO, we have to be very patient because we behave like a husband outside the hospital who is waiting for the good news. For us, it is an appointment. Thank you, Golden Aim Group, to give me this award as a effective DPO in Maharashtra. This is the second time I'm getting this award from this group, and I dedicate this award particularly to my family, my wife and son, including my father, because they are with me to pursue this passion in training and placement. Because training and placement work is like 24/7, because we have to cater industry, student, parent, management, and the regulatory authorities. Then I like to dedicate this award to the previous organization I worked for 16 years, Anmana Pustarak Mandal College of Engineering Technology, Amravati, which is in Tier 3 city. Now I moved to Tier 2 city, Nagpur, Julelal Institute of Technology, and again I thanks to the management who allow me to come over here and take this award in person capacity. Thank you. Thank you.
Thank you so much. Moving ahead, may I call Professor Sanjay S. Jadhav, TPO, MGM's College of Engineering and Technology, Navi Mumbai.
What I can say? Thank you very much, the Energy Group and Golden Aim Award team for giving me this award. This is my 15th award, and I am acting as a secretary of Maharashtra TPO Association also, which is the association working for the TPOs, for the students of the Maharashtra. I am dedicating this award to all the 500 TPOs sitting all the corners of the Maharashtra, who are making the career of the student, not only career of the student, they are improving the wealth of the one generation by giving the good offers. And rightly said by sir, we are working 24/7. It's the right thing. More than that, and it is very difficult to stay in academic and work like industry. The pain we can recognize. And thank you very much for. I'm also dedicating this award to my wife, who is also giving me always inspiration to go ahead. They are bearing me till night 2-3 p.m. I'm coming by completing the campus drives. Still they are welcoming me. So still she is welcoming me by a cute smile. Thank you very much for her. Sincerely.
She is laughing very simply.
Yes. Thank you very much, my TPO community. We are all the 500 plus TPOs working at the all over the Maharashtra, each and every engineering, MBA, higher education colleges, and these are making the career of the students. And I'm dedicating this award to all these TPOs. Hats off to all the TPOs. Thank you very much, and thank you, the Energy Group. Thank you.
Now may we have Swapnil R. Desai, Training and Placement Officer, Vasantdada Patil, Pratishthan College of Engineering and Visual Art, Mumbai. Come on, we can do it.
Good evening, all of you. Thank you so much, Golden Awards team, for considering me for this award. Thank you so much to my Vasanta Badal Pratishthan team to giving me work like this to eligible for this award. I'm from Vasanta Badal Pratishthan. We have 3 colleges: engineering, law, and architecture. In the engineering, we have 3 branches: computer IT and artificial intelligence data science. So I dedicate this award to my training and placement team. So thank you so much to Golden Awards team for giving me this award. Thank you so much.
Thank you. May we have Dr. Vineet Kota, Training and Placement Officer, Shah and Anchor, Kachi Engineering College of Chembur, Mumbai. Let's hear it for him.
Good afternoon, everyone.
Good afternoon.
I take this opportunity to thank Dr. Farheen Khan, the CFO and the co-founder of Golden Aim Conference Awards, Sri Farooqi sir, the CEO and the co-founder of Energy Business Solutions, for recognizing our efforts and giving us this award. I also take this opportunity to thank Mr. Atif Khan and Ms. Isha Mehta, who have been continuously coordinating with us. And last but not the least, our lovely host here, Aisha ma'am, who has been doing a wonderful job and keeping us on our toes right from the morning. Thank you so much, ma'am. One last thing, 35 years before I joined this profession of teaching as a passion, and I took up this additional responsibility of placements in my campus 27 years before. Initially, it was a very challenging thing for a teacher to take up this job, but then the silver lining in our life was, I realized that we are bringing a lot of light in the lives of not just the candidate, but their coming generations over and over again. Thank you so much, and I also dedicate this award to my complete TPO family. Thank you.
Thank you. And can we now have Neelam Sharma, Associate Professor and Head CRC, Bharati Vidyapeeth University, New Mumbai. This is for highly effective TPO in Navi Mumbai, New Delhi. Sorry.
There is that.
So hi all, this is on behalf of Dr. Neelam Sharma. So she couldn't be here, so she would definitely would have liked to thank everyone over here and being a part of this success, and she would continue to do good in education industry as well. So yeah, thanks. Cheers.
Thank you. We have an award for Dr. Manjula Lalwani Pathak. She's a principal. She wasn't here when I announced her name. I think we have you now. Let's hear it for her.
Good evening, everyone. First of all, I'm so sorry I was running late. It is lovely to be here with all of you. Nice to see this entire arrangement of the organizers. Actually, when I received your invitation, I decided not to come for this because I never consider myself as a effective leader in my area. You see, I am principal of a college, which is one of the largest college of University of Mumbai. We have 12,000 students and 400 staff. We offer 45 courses in arts, science, commerce and self-financing. We conduct 1,468 examinations in 1 year. We are the lead college for 10 colleges of cluster, and we conduct 1,55,022 lectures in 1 year. So with that pride also, I was feeling I don't think I am dynamic and effective, but I wish to share with you. Those are from education. They know the process of NEC. I think if Professor Godare or Dr. Prakash would be here, they would have understand the process of NEC. NEC is a rating, I think Madam knows, is a rating agency for from Government of India. It is a apex body from UGC. So on 15th and 16th, NAC committee visited to a college, and for 5 years of assessment of CHM college, and they came to give the grade to CHM college. The pattern is 70-30. For 70, we have to submit the data with the supporting documents, and for 30% they visited to college on 15th and 16th, and the NAC committee sent the team, and that team announced in front of my management and staff that she is a effective leader of your college.
Awesome. Well deserved.
And then I could courage to come here, and I think the person who was in my contact, I think Sameer or someone, I don't know, remember the name. I told him yesterday, yes, now I agree to come, to accept. Now I feel when at national level it is considered that I am a dynamic leader, an effective principal, so I should go and collect.
You are a genius also.
Thank you so much. This was my part of honesty, because I never know that what basis you people are giving this rating. But of course I believe in your merit, sir. I don't have any doubt. But I had no confidence that there are so many colleges. Like we have 800 colleges, more than that colleges in University of Mumbai, and we are in Ulhasnagar. Srimati Chandibai, Himmatmal Mansukhani college is in Ulhasnagar. So it run by the Hyderabad Sindh National Collegiate Board and HSNC board. They have 15 colleges. So out of 15 colleges, CHM college is one of the college. And I think all those are Mumbai based. They know RD National College, KC College, HR College, and Thadumal Shani College, KC Law College. So we are the sister college of the same board. But it is in Ulhasnagar. It's very far, and I think very less number of people must be knowing this college. But I must say, and proudly I say, that we provide the education to the most diversified students. Those belong to the very low income group as well as very high income group of the industrialists of Ulhasnagar Sindhi community. So thank you so much to invite me, and I think I must congratulate to the organizer to select me on the merit basis. Their selection was, I consider now is perfect. So thank you so much, gentlemen, and madam, those are sitting here. Thank you so much, and I feel privileged to be a part of it.
May I have Tejal Joshi and Sagar Cheta, founder of Pool City, Veramila. Ganesh Kumar. Can we hear it from him?
Because in fact should be also shared with Mr. Ganesh Kumar. I'll require you to come over here. So thank you very much. Golden Award, this is to be shared with him because actually, you know, behind the success is the partner.
Okay.
The husband has to be there, or
Yes.
for the wife, for the husband it has to be the wife. So it can't be, you know, anyone. A lady success has to be
Absolutely.
behind, and his success I have to be behind. So
I
that's-
second that.
Yes, you second that, right? So thank you very much, Golden Awards team. I mean, in fact, when you all gave me a call, it was like, how did you select me in the first place? That was, I had asked so many questions. That's what he's saying, that I think he's scared of you. It's nothing like that. I just wanted to check out on the merits what you have collected, and I really found that congratulations to you. You had a wonderful jury team who could select it, and that's very nice. So about myself, I am the medical director of Sainivas Healthcare, and he is the CEO, MD, founder of the Sainivas Healthcare. We are the chain of oncology centers pan-India. We have 35 chains. And we have the main branches at, it started with Thane, then Delhi, and I'm happy to say that, you know, whenever we as an oncologist, we talk about cancers, we do not want our patients to go into cancer, believe me, dear friends.
Correct.
All right, we want to work in the sector of preventive oncology. So I happen to see myself as a preventive oncologist. I would have trained, I become then, when we see patients coming to us with cervical cancer, the cancers which can absolutely be preventable, we do not want our patients, you know, when they come and look at us, how many years are you going to stay?
Correct.
And that's very bad thing to say that, oh, you are in the advanced stage. And that's the only cancer which is preventable. That's the only cancer which you can say zero to it. Okay, so this is a science towards it, and this caught me hold. I'm now 27 years in this practice. And I used to be a hardcore, you know, practitioner and a hardcore, like any other gynecologist or any other gynae onco. But then when we used to have this patients coming towards us, then something stirred my heart and soul, and definitely with the support of the family, we erected our healthcare, and from there on there was no looking back. So from 2005 onwards, we would have screened more than 1.5 lakh women would have gone, or even 2 lakh women would have gone screening. Mostly we work in, all the Adivasi villages also. We are going now global, and with that screening we could identify almost 50,000 women who are into the early stages,
Yes.
which can be completely preventable in the precancerous stage, and then we treated them. Now, dear friends, we all know people go for uterus removal operations.
Yes.
Any small thing, it's only the removal, definitive surgery. But we have had a slogan saying that save uterus, and we do not want patients to undergo the definitive surgeries. So we have treated people, around 50,000 people would have got treatment for the same, so that, you know, with this OPD based procedures, so that they have not gone into cancers, and their uterus is also saved. So in this way we have really, I'm very happy to say that, you know, because of Almighty's support, it's not possible otherwise in this era, the fast era, to get into all this. But people started respecting me as teacher, and then we went ahead teaching the science, the path which we walked, because people used to laugh at me
when we used to do these things, when we could have earned so much of our money by doing hysterectomies and all that.
Correct.
So when we went into this path, people started initially having criticisms. We had walked a very hard way, and now we are one of the reputed ones in the country, globally also, as teacher. We get candidates from pan-India globally to learn. I would have trained more than 1,000 gynecologists. Most of them are HODs of the brilliant all institutes like AIMS and Lady Harding and everyone. They're coming to learn from us the art of colposcopy, the science of preventive oncology. From there on, I metamorphosed to become an author. Now my books are with the CBS publications, are now running into the 3rd edition with an atlas. And this has been read by the UG, PG candidates of medical grad students. They do even PhDs with the books. So it's simply you start flowing into the track which has been selected for you. Then we found that there was not much of a good instruments related to that. So we formed a company. From there on, went on to Srivari Medical Equipments. So we started building up, instruments related to the field, giving it to others as well. From there, we thought the pathology is not that great in the country, and then we do not want to follow the trap of commercial pathology business. I mean, I don't want to.
This is very rare.
Very, very rare. So I thought, why not have your own state-of-art pathology? It should be a molecular biology lab. So we then developed a biomolecular lab in Delhi, and I'm very happy to say that we have almost 250 to 300 doctors who are attached to our lab, pan-India.
This is impressive.
And that's how we are now doing in HPV testing, PAP testing, STI, BRCA testing, and everything related to cancers. So, and then we have, courses running, and the whole calendar is full. And then I became a WHO teacher as well. We have federation called as Federation of Obstetric Gynec Society of India, called as FOXY. So I am also the chair of the Oncology Committee National of the FOXY. And also I happen to be the trainer and teacher for them. I happen to be WHO identified our work, and then identified us to be training. So in this way we have been just flowing across. Even now when I came late, I'm so sorry. I had my candidates who are already, come from yesterday. Doctors have come from Doha, from Dubai, from everywhere to learn. So that's the reason I came late. But thank you very much to give us this award.
Thank you. Dr. Priya Ganesh Kumar, I would like to tell you that now I understand why you were, in a dilemma that what category is this award, because you already achieved so many things. So you really doubted which one actually. But yes, hats off to such family. I think we should add one category more, the family for human deeds, right? So we should add this category where the entire family is into, helping humanity and stuff. So awesome.
Yeah. In fact, we don't get CSR from anyone, let me tell you. It's normally people keep on wanting CSR funds,
Yes.
And I always say, we always believe, why can't we from our own thing give it for the community? When people can give so much to us, why can't we give it?
Absolutely.
And in fact, when we did this Adivasi villages, we have a huge team, who goes for screening and breast cancer and cervical cancer examinations. When we find them, we do not just take, pics for, Facebook or Twitters or anything.
Yeah.
We do real hardcore work. We then take our vehicles, we bring them to us, to our Thane center. We treat them absolutely free of cost. Which is being charged 80,000, might be 70,000. We charge them free. We give it from our pockets. Moreover, they are even given that 1 day wages. Those Adivasi villages, they are those rag pickers or wood cutters. They would lose their daily wages, So we give them 100 rupees as though it's like a need for me. But no, it's not.
It's for the humankind.
It's for the humankind. And then on the top, we give them food, ration, and bring them back and send them back. And then we have a surveillance. Every 5 years, we'll call them. And so this is, I think, can be emulated. It's a small way which we have done, but can be emulated by many. Why only think about CSR funds?
Absolutely. I'm so touched. I'm really touched.
Thank you very much.
Honor to have you. This is yours. Thank you. Just one more. May we have the category of Quality Healthcare Leader Award, Radiation Oncologist and Genitourinary Surgery. May we have Dr. Triranjan Basu.
Thank you, Golden M Awards. It's really an honor and privilege to receive this. This is my second award actually this year. So I heard from my last awardee, it was commendable. So from preventive oncology, I work in something as a treatment oncology. I'm a radiation oncologist working for more than a decade. I work in a cancer center in Borivali. It's called HCG Cancer Center. We are a comprehensive chain of oncology units pan-India. So to put things into perspective, I treat patients with cancer. So yeah, we do see, like Madam was saying, people with early stage, people with advanced stage. So it just happened. So last week I was traveling for a conference, so someone next to me, the flight asked that, like a routine chat, that what do you do? I said I'm an oncologist. So it's like, how you keep yourself so sane? You're humming some songs. So I said the biggest learning maybe in life, seeing cancer patients, it's don't try to get sympathy out of it. The empathy is what is needed. If you start sympathizing, you lose your saneness. Because one has to be there in that place also. When I chose this in 2010, I completed my masters. I came to TMH for my training. So someone in my family asked, why you chose such a morose field? So first of all, no doctor chooses their field. You get chosen by the system we are trained into. Yes. But then yes, someone needs to be there also. I cannot say that it is like going back to the leprosy era, that they are untouchables, we cannot treat them. And the brighter side, which many people don't understand, actually there are many cancer patients and many cancer survivors who are extremely positive. I rather draw inspiration from them. They are so positive. So I guess this award belongs to all of them and all of the inspiration I got from them. Thank you.
Thank you. Thank you, Professor Dr. Devakaran. It was a pleasure. Moving on to our next category, that is real estate. May we have our first speaker for real estate, Swapnil Patil, Vice President, South Metro City Association of Realtors. May we hear it for him.
Good evening, guys. This is one topic I think which is close to everybody's heart. You know, real estate is like a very generic topic, and today I'm going to speak about sales automation in real estate. So, how many people have? Let's keep it very interactive, and I will not take much time. But anybody who has invested in real estate very recently? Anybody who's bought a property or a commercial real estate? Okay, where, sir? Mirror. Okay, fantastic. How was your experience overall? Was it complicated or was it easy buying a property? Very complicated. So rightly so, it's a very, very complex process when we talk about real estate. You know, though it is something which is very interesting, and every one of us would like to own a piece of land or a commercial real estate or a residential real estate. Having said that, the process is very complex, right? So here, what we help you do is, let me introduce myself. I am Swapnil Patil. I represent a real estate company called as ASAP. The name itself, suggests that we basically make the job very simple as soon as possible. Right? That's literally the meaning of the name. So what we do is we basically get into real estate, making it very simple as a process for somebody to buy real estate. So when we talk about sales automation in real estate, let's understand what is the cycle that typically a real estate professional goes through, right? So basically there are leads. Nevertheless, So basically, the process is pretty simple. As a real estate professional, what we do is we try to interact and engage with the customer. Once we engage with the customer, there are several platforms on which we engage. So there are a lot of social media platforms. So now you would have seen very often that real estate, if you go to Instagram, if you go to your Facebook, or if you go to your Twitter handle, you would see a lot of advertisements which are being posted for real estate advertisement. So now video has become a most interactive medium to connect with the consumer, right? So you have social media, you have blogs which you read typically about real estate. There are different type of calculators which you guys use. So this has become a medium of engagement and interaction. So through this, the leads are coming into the system of a realtor. These leads are then basically filtered, captured, and then processed to understand the stage of buyer purchase. So at which stage the buyer is today for the purchase, and then subsequently, the engagement happens with the customer. How sales automation helps us is basically, so if you go through the entire cycle of real estate purchase, they start with something called as lead collection, lead engagement, where you have telecalling, you have social media, all of this. In this, the leads are captured, and then there is data analytics now, which is typically called as artificial intelligence. So you have this artificial intelligence which is being used now to understand real estate. So let me give you an example. So if you have inquired for a property in Mira Road on some portal or some social media site, you would typically see that there is an algorithm which pushes all the ads which are in Mira Road for the real estate piece, right? So you will keep seeing these ads on your Instagram. Now what is it? The Google algorithm, which is called artificial intelligence, it identifies you as a target audience or a potential customer, and it will keep pushing similar advertisements to you. Like if you have checked recently for say a Tata Harrier, right, which is in the automobile space, so you will see that all the other competition, which could be your Mahindra or which could be other companies, you will start seeing their advertisements. So what is all of this? Why is this happening? So all of this is happening because you see a lot of artificial intelligence being used into all the sales process now, right? So that is one very typical form. Now coming back to this, the leads are captured, you're converted into a prospects which eventually become a customer, and then you have basically a transaction cycle which runs through. So this is how typically we do a real estate sales funnel. We define who is our target audience, who is actually going to buy a property say in Worli or in Andheri, right? Then we decide on the real estate CRM, design the lead capture magnets which are typically your social media, or as I said, a lot of artificial intelligence is used in basically zeroing down on the target audience. So once that is used, then we show them the landing pages of our property where they interact. That is the first point of contact for the customer. So you click that, and once you click that, there is a pop-up which says you put your number and you put your name, right? So that's typically first point of sale contact for a customer. So that is where the lead capture happens. And then there are a lot of several auto marketing tools, which is like a WhatsApp. There are chat box which are used typically. These are again used to interact with the customer or to send them the details about the project. So typically once you click that lead, you will see on your WhatsApp typically there is a message which pops up with all the brochures, all the videos about the site, maybe a walkthrough about the site. That's how the engagement starts. After the engagement starts, basically we nurture the leads through the offline sales process. So real estate is still one sphere or specter where the purchase is offline, right? So we have still not advanced to a stage. So typically I'll tell you, if you want to purchase a mobile, what do you do typically? You go to a showroom, you want to see the mobile, you want to see the car, you want to experience the car, you want to open the door, you want to see the screen on the car, and after you have done all of that, then you go online to see who is offering the cheapest price, because the product is standardized. Say example, if you're buying iPhone 14, iPhone 14 is a standardized product. Now when you're buying iPhone 14, what you typically want is to go and touch, feel and understand the product. Once you have really understood the product, you want to see who is giving you the best price. So then you go online and you initiate a purchase online from the vendor who is giving you the cheapest price. Now here, real estate is exactly the opposite of it. All the research happens online. You go online, you go to Magic Bricks, you go to 99 Acres, you go to multiple websites, you see all the project details there. But when you have to initiate actual purchase, you go to the site, you see the sample apartment, and that's where you actually buy an apartment or do a transaction. So that's how real estate is research online, purchase offline. So that's how we do the sales. Now these are typical lead management things. So we map out the sales process. From there we define the criteria which are there for the marketing and sales. Define success metrics. So when I'm running a digital marketing campaign, which is called typically a performance management campaign, right? After every campaign, we re-look the criteria. So example, if I'm running 3 digital marketing campaigns, right? After a cycle, we again go and check the stats for which campaign or which creative has given me the maximum impressions and maximum inquiries. So then that campaign is optimized. So there are 3-4 campaigns which are running. The best campaign is then optimized to basically derive the best leads out of that, right? So that is how typically it happens in the digital marketing. So these are few of the sales automation tools that we use. Data analytics. Now example, if you are going to buy a property in Mira Road, sir, what would you have done? You would have seen one particular property, or you would have researched many properties, right? So before you research a property, there are certain tools which are available now. There is CRE Matrix, Zapkey, Prop Equity, PropStack. So if you put Mira Road as a location, now there are 2 websites, which is CRE Matrix and Zapkey, that will give you exact transaction details in that building in last 6 months. So you can actually go and pull out the agreements which are registered from Zapkey, and you can see that in that particular building, say example, Avigna Heights, right? Avigna Heights in Mira Road, you can actually pull out 5 agreements which are registered recently, and you know exactly at what price points they have been transacted. So when you are going for a purchase, you are already educated and you know exactly what is the point, what is the transaction price that you will be able to close your deal at, right? So a lot of insights now customers get online because of all this tools which are available. So if as a caller, you would have seen a lot of automated calls which you get now. If you receive the call, there will be an automated tape which would say, welcome to this new project which is in Mira Road, right? Welcome to so and so project, all of that. So those are all automated sales call which is given by companies like Molarity, Neodo, SmartFlow. So what this does is, this is again a part of sales automation. Now if I'm using a resource to make 100 calls a day, right? Imagine the time and the resource which is wasted there. So now the sales automated pre-recorded calls, what they do is, if you register an interest, right, they can do 1 lakh calls in a day. It's an automated system. So they can just dial, in one call they can dial 1 lakh people, and 1 lakh people are reached. Out of that, if somebody registers an interest, it becomes very easy to do a follow-up. Instead of one telecaller sitting there and doing only 100 calls a day. So that's the power of automation now. Again, you have MailChimp and MailMarket, a kind of website which can send multiple emails at a time and which can come to your inbox. So if you're interested, you will respond, right? So these are different ways of reaching the customer. Social media, of course, has become the most popular one. And in social media also, if you see now, the most engagement that happens in real estate is through video or YouTubes, right? So gone are those days when you have a static post and people respond to it. Now people like more engagement because of video. You will see TikToks, and you will see, obviously TikTok is banned now, but you will see YouTubes and more video programmatic sites which are taking over from a static or dynamic marketing plan, right? So you will see a lot of people actually going to the apartment, showing the sample video of the sample apartment, or you will have walkthroughs, or you will have videos which are very interactive. So that is how, again, automation has helped. Now, if you remember very clearly, for last 2 years, real estate has been completely switched off because of COVID. So when COVID started, as I said, the research is online, but the actual transactions happen offline. People want to meet, see the sites and all of that. So what happened in real estate during the COVID is it was completely a standstill. Nothing was happening in real estate. So that time, real estate guys, they actually innovated and they thought, let's do something where we can still do business. So that's when they started using AVs, right? Audio visuals. They started using interactive webinars they started using a lot of tools which give them option to engage and interact with the customer on a video call. So all this sales process, they got automated. So the sample visit or the stage, what I have called as a virtual staging of the property. So we started staging the properties virtually, which means I would record the property completely, right? I'll make a nice video of it, which will be very interactive. So this is like a gaming platform. On a gaming platform, you enter the house, you actually enter the house, and you can click where you want to go. So how you basically play games on an interactive platform. So we started building an interactive platform for staging the property. You could see the property. Say you're sitting in Dubai, you can see a property in Andheri, and you can actually walk through the apartment. After you have liked everything, you can also see the exterior views of the apartment. What is there? What is on the outside? मेरे living area से क्या दिख रहा है? मेरे को bedroom से क्या दिख रहा है? Right? All of that is seen. You can go to 15th floor. You can go to 18th floor. So there are drone shots which are taken. Right? How do we build it? Is basically it's built on a system called as Open House. Open House basically is a platform where entire Bombay is mapped. Now every Bombay building is mapped. On that, if there is a new project which is launched, and if you don't have a sample apartment, it's at the plinth level, we build a digital twin of the building. So the digital twin of the building is built, and in that digital twin, what we do is we basically render all the apartments on every level, and we patch it with the drone shots which are taken at all the heights. So example, if you want to see the 15th floor, we patch that with the 15th floor drone shots which we have taken on a 360 degree. So that makes you basically, what you can do is, if you want to see that apartment, you can walk into the apartment, you can navigate through the apartment like a gaming platform, and you can see the apartment sitting there in Dubai, and you can make your decision, right? So real estate has become very, very progressive, and now there will be a stage when actual transactions will also start happening digitally, right? So that's where the blockchain technology will come into picture. In blockchain, what will happen is all the agreements which are there, they will be registered through a blockchain technology. So now you go to a registration office to register a document. Maybe in a decade's time, everything will be digitalized. All the agreements, all property, saat baras, everything will be digitalized. And all you have to do is you have to select a property, and you tell them that I have paid the money, and everything will be done online. You don't have to go to a registration office. So that's the power of the blockchain technology that we will be talking about. So this is how, this is just a small snapshot of what's happening in real estate, because I think this event is for something else. Yeah, so I would not take more time. So this is what is happening in the real estate space. And with this, I would like to conclude that, you buy real estate and stay with it. You don't wait to buy real estate, but you buy real estate and wait. I think that is when you will get the maximum benefit out of the real estate. So with that, I finish my 2 bit. Thank you so much.
Young Managing Director of the Year for Real Estate Sector, may we have Abhijit Chandrakant Bansali, the Managing Director for Real Group. Women Business Leader Award for Real Estate Sector, may I call upon Mrs. Sujata Srinivasan Rao, Partner IVY Realtors.
much of your time. Good evening to everyone. And thank you also to everyone who are present and who have already received their awards. I thank Dynagic Solutions and Golden Aim for the wonderful platform that they have created to acknowledge people of their accomplishments, which motivates them to move much further and set their own targets higher, set higher goals. So in that sense, I really congratulate you guys for it. And a small brief about ourselves. I'm Sujata Srinivasan Rao from Ivy Realtors. We're a partner at Ivy Realtors. We have a project right here at Ivy Villa Parle, G+13. We have come a long way in business. We have basically a family business house. Earlier we were in the oil and gas sector for nearly 25 years. From there we have divested as investors in real estate, and then we have had broking team. From there we have come to development. We have our completed project in Dubai at Heartland community of 135 apartments, and now we've entered the Mumbai market right at Villa Parle with the G+13 redevelopment tower, and much more to do in Villa Parle because it's giving us good response. And we are also evaluating other projects at Navi Mumbai and other places. So this is where we are. Again, thanks to everyone, and thank you to the real estate sector, like how he just said about the technology and other things, which has helped us move on even during the hard COVID times, with all our channel partners and real estate brokers really trying to innovate and find better methods through technology to get customers to come and conclude the deals. Thank you, everyone.
Thank you. And for the real estate sector, may we have our second speaker, Architect Sanjay Taskawkar. He is Honorable Secretary, Architect Engineering and Survey Association.
Well, good evening, everybody. A brief introduction of me. I am Architect Sanjay Tasgaonkar. I am based in Pune, and I am representing here the Architects Engineers Association in Pune, ASA. And I've been in practice since last 32 years, and I've seen the transfer of architecture from the drawing board to the digitalization. So, Mr. Swapnil just mentioned how the things are going on fast on the sales platform, and many of the things that are showcased in the sales platform happen actually through the architectural background actually. So as we have seen since morning and everywhere, almost all professions are affected. Mr. Patil is also hopeful that the agreements or the sales activity will be digitized. I am also hoping that the approvals of the plans will be digitized. We are waiting for it last many years or decade, I would rather say. The part which leads to the actual approval maybe it is not digitized, so we are waiting for that. So many tools and softwares, we have listed out a number of softwares and tools which are available as per the requirement of that particular profession. So moving ahead, what is the impact of digitalization? So here we see the increase in productivity, like what he mentioned earlier. So there is fast reaching out to the customers. Again, the efficiency and the accuracy. So you can reach the particular person very fast in an accurate way. Automation, of course, is there. Visualization, which is the most important part in the real estate. So whatever like he said, a person sitting in X area can really visualize and feel the things about some Y region. And of course, this has created many new job opportunities. Moving ahead, it has also improved the collaboration. So the various players in the, say if we are speaking about real estate, the various players are now, they can easily go ahead hand in hand, they have good communication, there is a good customer satisfaction. We have very nice innovative tools and devices which help you to really take up to that level. The coordination between the various consultants as far as architecture field is concerned, the person sits in his office and gets connected to all his consultants and his team and really can develop the entire project very fast. Of course, that leads to sustainability, less paperwork is there, easy access, information flexibility, time zone. I am speaking in the way that, like he said, someone sitting in Dubai or some other country can really have access to the projects in India, and of course he is sitting in his daytime, whereas it might be nighttime over here. So what are the various applications? Now, as far as architecture it goes, it was only the drawings that really makes the project. Now earlier, like I said, I've seen the transition from the drawing board to the computer screen, and also I am now giving the presentation using the digitized medium. So the drawings that we used to do now, we do it on the computer aided designs or the drafting, what you can say. We have nice 3D visualizations that can be done. Room scanners. Actually, this comes as a later on part, supposing we are doing any interior designing of this particular hall. So I have a room scanning of the entire room, bare walls and bare slab, and then I have the entire data with me without pulling out a tape or something of that sort, and I get all the data that I need within my device and develop upon it. The other thing now that has come out is 3D printing. So visualization online also can be done, and physically also, if at all I have any doubt, I can really 3D print it. But of course, for all this, my knowledge of the person who is using it, the knowledge of that person has to be pinpoint. If he doesn't know how to draw a particular line, he won't be able to draw that line on a simple AutoCAD or CAD platform. Now, these are the latest things that have come out. The building information modeling. Now I was speaking about this room, and if I say that above this false ceiling there are n number of services which are running around, fire services, the electrical, there is the AC running, maybe the screen and the Wi-Fi system, I can see some fire equipments over here. So all these things, I can develop it on the BIM platform, float it directly, have my actual visualization of what is going to be the final outcome, and have the entire plan or the details of the services which are running within a single layer. And whichever layer I want to see, I can just put it on, and later on it is easy for the people who are maintaining the system, because post the building you need the maintenance also. Again, the artificial intelligence, the virtual reality, what he was speaking about, the walkthroughs, or you directly feel like you are walking into that particular space. The building is being, not yet even the foundation may not have been laid over there, but the building is already standing over there virtually, and you can really take a round over it. That is what is done in the augmented reality. And of course, the geographic information system, which is very important as far as the architectural field is concerned. Now, when we said the GIS, we come to the surveys, because when I start my architectural process for any project, I need to know what is there on land. What is that particular land, whether it is a flat land, it is a sloping land, water bodies hai ya nahi hai, what all things are there. So I need a detailed survey of it, and in such cases the drone surveys are very much popular nowadays. You can cover acres of land or hectares of land within a few hours, and you get the entire contour mapping of that particular land in millimeters. Again, based on these surveys, I can go ahead with my drawings, I can design my projects, and the drawings again are on the CAD platform. They are the 2D drawings or the 3D views. The 3D views are of course walkthroughs for the developer or the customer who wants to really visualize how his building is going to come, whereas the 2D drawings are for the contractor or the people who are going to actually construct it. Now the BIM platform also helps in the construction of for the people who are going to really do the work on site. The more detailed drawings are really can be done in the BIM platform. The BIM platform again helps me if I've done my drawing very correctly on the BIM platform. I can get the estimation of each and every material that is going to be used on that particular project, up to the last brick. So I need not really go on calculating in number of pages, the measurement sheets le lo and the abstract and all these things are not needed. I just have to do my drawing correctly. It directly says your brickwork so many cubic meters, your plaster is going to be so many square meters. If I want something else on my plaster, some texture, if I want some cladding over there, that also can be separated out, and I get the entire quantity there and then. I change the specifications easily on this platform. I can easily calculate the amount that is going to be there. What changes the developer or the owner he is going to really have to bear, because whatever changes the plan में से सर मैंने वहाँ पे देखा था वो बहुत अच्छा था, अपने यहाँ पे लगवा लेते क्या, चेंज करके देखो कितनी क्वांटिटी है, पुट इन द कॉस्ट, फाइनल आपको 10 लाख एक्स्ट्रा पड़ेगा, ठीक है कर देते. Because I have seen, we have done n number of bungalows. So bungalows में when the things go on in the finishing mode, of course the lady is the, I won't say king of that family, the queen of that family. So she wants everything as per her requirements or her liking. And then she says, वहाँ पे मेरे सहेली के घर में देखा था, and I want something of that sort. So then the architect what he does, he places that in the drawing, or he gives another option. ये भी कर सकते हैं, वो भी कर सकते हैं. So that is how things are very simple nowadays with the digitization. Accurate estimation, that is what I said. I have a single panel, if I have done the drawing correctly and I have put it on various layers, I can extract the exact quantity of that particular item and I can accurately estimate it. That helps the contractor also to procure the materials. Because if I say कि ये इतना इतना यहाँ पे बनाना है, तो वो material, if it is informed to him well in advance, he can procure it from the market and keep it ready to have a very easy flow of the construction. Now this 3D printing, we have spoken about it earlier, it really helps when you are creating something different. Now you might have heard many times that there is a parametric architecture wherein the entire surface or the form of that particular building is totally organic or inorganic, whatever you call it. But then these various forms can easily be printed through a 3D printer. Now if you go construction part of that entire architecture as a part, so again 3D printing helps the developer or the owner to create smaller three-dimensional models. Earlier the models used to be done of mount board or some other board. There were even acrylic material sheets. कट करके बैठो, ड्राइंग के हिसाब से जोड़ते बैठो, फिर को लगाओ. There used to be lots of time that used to be taken. Now you do the entire drawing on the BIM platform, feed that to the particular 3D printer, and you get a small scale model, true proportionate model of that particular building. Now, of course, there are videos many of you might have seen. कि बड़ा बड़ा घर भी you can do it on a 3D printing, but of course that is a very big thing that cannot be applied everywhere. Robotics is now very much popular into the construction field. There are many areas wherein a human intervention cannot be done very easily, or there is a part of safety that is there. We see many times in the newspaper, we read कि कुठल्या तरी septic tank मध्ये their laborers, they went in to clean that septic tank and they died because of suffocation. Now in such cases, the sufficient safety is not taken, and here the robotics really help because you have many autonomous vehicles which are available. You can put that vehicle, the whole thing, it scans the entire area, it searches for any problems if at all there are there, and you can get it back. You do see such kind of videos of in the medical field wherein laser technology says there is some needle which is inserted into a blood vessel and it goes somewhere in the entire body and comes back. The same thing can be done in the construction industry wherein you have problems in a pipeline or a drainage line, you send in the autonomous vehicles or the robotic thing and you can identify where the problem can, because the projects are not smaller now. When I completed my architecture way back in 1989, the projects were very small. The bylaws were also restricted. कि नहीं ground plus 2 के ऊपर कुछ मत बना. Now 100 meters building बना दो, 100 floor building बना दो. Even in India we are now seeing Mumbai has many tall structures or the most high-rise buildings are there in Mumbai. So all these cannot be just done हाथ से करो or the labor is just dangling somewhere upwards. वहाँ से बैठ के plaster कर रहा हो external. Yeah, you can see now many glass facades coming up in the city and the people cannot clean them. But in such cases now, the robotics or the autonomous vehicles can be really useful. And of course, it leads to the increased productivity. Drones, again, like what he also mentioned, what is there when we use it for our particularly surveys. But now in the construction also, if at all there is anything that is found difficult for the person to reach, you can go through the drone camera, identify what is wrong over there, and you get all the data that you want. And like what Mr. Swapnil said, for the augmented reality or the virtual reality, everything can be through the drone. So that's all from my side. Thank you. I would like to thank Mr. Farooqi and Dr. Fareen Khan, the entire team of Golden Aim and Dynergy. Thanks a lot.
Thank you, Mr. Daskar.
I don't think there are any architects over here and anyone would have any doubts about this. If there are any questions that are popping up, we can easily discuss about it.
Sure, we can. Can I have Mr. Azhar Farooqi coming up at the stage and Thank you. So please stay on the stage because I'll be calling Mr. Swapnil Patil once again. And may I have both of you felicitating your near and dear architects for the most dynamic architect of the year. May we call upon Architect Premnath, Principal Architect Premnath and Associations, please.
Thank you, Golden Aims, for choosing an old man, an 80-year-old person, and calling him most dynamic architect. Well, architects are supposed to be smarter people. Architect is supposed to be ahead of time. He has to know everything in life over there. He was static for some time during COVID, but during COVID we learned how to become more dynamic, learning new technology, new trends, new ways, working from home, and doing new kind of media or running a business. An architect I have to be doing ahead of time in terms of new technology, new trends, new materials, economics, finance, construction, contractors, new developments. I don't know everything. So architect has to be dynamic.
Yes.
So when you say most dynamic, of course, I thank you very much. We will happen to be, of course, keeping edge and fortunately to be good health and moving ahead. And I wish everybody success, everybody. My compliments to my council and the other winners also there. And thanks for choosing me being in this place.
Thank you so much. The honor is all ours, sir. Thank you. My husband always told me I don't understand real estate. And I always agreed to him, but not your honors. I'm going to go and tell him that I met best of the architects and I have learned a lot about real estate, so now I know what it is. Yes. But this knowledge is more enough. So you can be on stage, sir. Thank you so much for your time. Going on to the next award, may I have the Best Marketing Leader of the Year, Real Estate Sector, Miss Ayushi Usher, Director of Usher Groups. And may we now have the most iconic architect of the year, Mr. Anil Bhaskaran, Managing Director, Chief Architect and Urban Planner, Idea Center Architects Private Limited. Dynamic Marketing Leader of the Year, Real Estate Sector, may we have Ms. Anita Gulwari, Head of the Marketing and Communication, Hiranandani Communities. Do we have you, Miss? The Dynamic Healthcare Leadership Award, Dr. Ashwini Jogade Pandale. She is also here to collect the award on behalf of Professor Dr. Pradeep Bhosle for the iconic Healthcare Leadership Award, Orthopedic Surgeon.
So thank you the juries, thank you all the dignitaries for considering healthcare as a sector. So in various times, especially after COVID, everyone has realized the importance of health. So here we are there at Nanavati Max Super Specialty Hospital. We have the all subspecialties, we have all the centers of excellence. You name it and we are there. So God forbid if anything is required, we all doctors are with you and wish you all in advance Happy New Year. Wish loads and loads of great health and success for all of us. Thank you.
Thank you so much. Thank you for your valuable time, sir. Before I vote or thank as a host, I would like to call upon once again Dr. Farheen Khan.
evening, everyone. Thank you to all the esteemed participants. It has been an honor to have you all present in our event. Your participation ensures the success of the event. Once again, I thank you everyone for all your kind support. I would like to thank to our esteemed speakers of the day, Dr. Meenakshi Deshpande, Dr. Manoj Gandhi, Ms. Jyoti David, Dr. Prakash Divakaran, Dr. Rashmi Tiwari, and Mr. Swapnil Patil and architect Sanjay Tasgaonkar for sharing your kind support with the organization. Again, I look forward to welcome you all in the next Golden Aim conference. Thank you everyone. Goodbye. Thank you.
Thanks to Almighty, I, Aisha Sayed, on behalf of Golden Aims Conference and Award for the Excellence and Leadership, and the entire fraternity of this organization, first of all, extend my most sincere thanks to Almighty God for making today's event a resounding success. With His blessings and grace, we are able to make this event what it is. Thank you for being the best audience and showering your love and patience. Thank you.